Muy buenos días a todos. Quisiera darle la
Good morning, everyone. I'd like to welcome the members of the Executive Committee of all participating states participating as observers at the 174th session of the Executive Committee. We will spend a couple of days to exchange our views. We have days ahead of us to work hard on essential issues to be dealt with by a region. And it does refer to the importance of being able to work together, being able to delineate strategies and plans of action that will give a timely response to all our concerns on all matters related to health. I would also wish to let you know that since we have 7 members of the Executive Committee present in the room, Argentina, Bolivia, Canada, Chile, the U.S., Jamaica, and Uruguay, we do have a quorum. Therefore, we formally open this session. Besides the following member states that participate as observers: Brazil, El Salvador, Colombia, Portugal, Spain, France, St. Lucia, and Mexico. Having said this, I'd like to give the floor to the Director of the Pan American Health Organization, Dr. Jarbas Barbosa. Thank you very much. Good morning, everyone. Mrs. Gabriela Gomez, Director of International Relations and Cooperation from the Ministry of Health of Uruguay, as President of this 174th session of the Executive Committee. Mr. Alejandro Alvarez, Third Secretary, Interim Representative of Chile before the OAS in Washington, D.C., as Rapporteur for this meeting. Mrs. Mary Lou Valdez, Deputy Director of PAHO as our Secretary, distinguished members of the Executive Committee, colleagues, observers, ladies and gentlemen. It is an honor to formally open the 174th session of the Executive Committee of the Pan American Health Organization. PAHO would like to express its gratitude for the ongoing cooperation offered by the member states, and I'd like to thank the Executive Committee for its ideas and guidance in the coming days. PAHO has been working hard in order to continue protecting our population and to expedite the recovery of the region from the pandemic. The risk of preventable diseases through vaccination is at its highest point, and there is an urgent need to continue stepping up the immunization coverage.
Buenas noticias
We have received very good news in the last 2 years. The region has strongly started to increase immunization coverage, but we still have to continue deploying that effort. It is essential that we improve maternal health indicators that, as we know, in some countries have not reached 100% during the pandemic, as well as neonatal and child indicators, and to deal with the burden of non-communicable diseases, including mental health disorders. Another issue that was strongly underscored by the pandemic all over the world. The threats brought about by the weather with extreme meteorological phenomena and the spreading of vector-borne diseases pose additional risks, and they become even more acute as we go into the heart of the hurricane season. More than ever, we trust in the capacity to respond by our region. The efforts and investments by our member states by way of a response to the pandemic has saved lives, increased access to essential tools, and helped us deal with the critical gaps in our health systems. The urgency, innovation, and solidarity that we showed in order to overcome COVID-19 ought not to be reserved for times of emergency. We need the same urgency and the same creativity in order to deal with our most overwhelming health challenges and to ensure equitable access for all in the Americas. And let me switch.
Aware of the complex range of health challenges facing the Americas. The Executive Committee meeting provides a valuable platform to shape the organization's approach to addressing these challenges and ultimately improve health outcomes across the region. In particular, I look forward to identifying solutions to the considerable strain on our region's health workforce. These solutions will enable us to build more resilient health systems and strengthen pandemic preparedness. I am also excited to discuss new and innovative strategies that will be presented to this Executive Committee meeting, like address climate change with equity, strengthen information systems for health 2024-2030, strengthening of public health functions 2024-2034, strengthening of tobacco control 2025-2030, integrated emergency, critical, and operative care 2025-2030, epidemic intelligence and health emergencies 2024-2029. We will provide an update about our Latin America Center for Perinatology, Women and Reproductive Health, CLAP, in Uruguay, and a new way to deliver technical cooperation on these so relevant issues. And we will discuss the charge assessed on procurement health supplies with relevant actions to improve PAHO's revolving fund. And I am keen to map out concrete actions that we can take together to expand primary health care and help advance universal health coverage and access. In closing, I want to leave you with a reminder that our organization was born from the idea of Pan-Americanism. Indeed, it is on our very name. It means that we are stronger when we work together and more effective when we pursue our goals with a common voice and purpose. The power of Pan-Americanism is just as potent today as it was more than a century ago. And I believe it's one of the keys to building a brighter, healthier future for our region. That means we must work in unison to promote the robust investment in national health agencies to ensure that public health remains a policy priority for all member states, especially now that the pandemic has ended. At the global level, we must push collectively for the Americas to lead in public health innovation and play a more prominent role in shaping the global health agenda. In doing so, we can make certain that the unique needs of our people and communities are met. Above all, Pan-Americanism reflects our unbreakable commitment to health equity. We must therefore be relentless in our pursuit of universal health coverage and access to guarantee every person, family, and community in the Americas has an equal chance to live a healthy life. Thank you. Gracias.
Thank you very much, Distinguished Director. Before I give the floor to Mary Lou Valdez, I'd like to extend a welcome to the representative of Ecuador, member of the Executive Committee, and also to the delegate from Cuba as an observer. Thank you very much. And now I'd like to give the floor to Mary Lou Valdez, Deputy Director of the Pan-American Sanitary Bureau, who, acting as Secretary of the 174th session of the Executive Committee, has some...
Muchas gracias, señora Presidenta, y buenos días a todos. Conforme a la regla 49 del reglamento del Comité Ejecutivo, los lenguajes de trabajo serán los de los miembros del comité, por lo tanto, la interpretación se ofrecerá en inglés y en español. Se les pide a los delegados que por favor den su nombre y país cada vez que tomen la palabra, facilitando así los registros oficiales de las intervenciones. Los miembros del Comité Ejecutivo tendrán la palabra primero antes de otros miembros que puedan participar como observadores. Y como siempre, todos los miembros deben limitar sus intervenciones a 3 minutos. Por momentos...
Instructions for use of are as follows. To request the floor, please press the silver button in the middle of your microphone base. The green light, which means request, will light up to indicate your request has been registered. Please note that pushing the silver button a second time will result in your request being deleted from the queue, and your place on the speaker list will be lost. To speak, the president will recognize your request, and the red light will light up to indicate that your microphone has been activated. Your microphone will be live as long as the ring on the microphone is red, and the ring is right here. When you finish speaking, please press the silver button again to disconnect the microphone. We would like to remind delegates to please send their interventions to gbo@paho.org, as this will help with the preparation of the final record, of the preparation of the final report of the session. Please ensure that each intervention includes the name of your country and the item title written in full, along with its corresponding agenda item number. For access to documents, daily programs, and updates during the session of the Executive Committee, these are available on the PAHO webpage and through the PAHO Governing Bodies app. You can download the app to your laptop or smartphone, and we encourage you all to please use it. Each delegation has been provided with an iPad in front of you. The documents and the presentations for this session of the Executive Committee have been uploaded to the iPads, and any updates will be uploaded directly onto the same pads. A commemorative photo of the Executive Committee participants will take place at 12:30 p.m. today in Room A as soon as this meeting breaks for lunch. Also today at 6 p.m., our director, Dr. Jarvis Barbosa, will be hosting a reception in honor of the participants of the Executive Committee. This reception will take place in this building on the 10th floor. And finally, please note that this room has 2 exit doors at the back of the room. In case of an emergency, please proceed to evacuate through these 2 doors in back of us and follow the instructions given by the floor wardens who are wearing an orange vest. Thank you, Madam President.
Muchas gracias.
Thank you very much, Ms. Mary Lou Valdez. Before we proceed, we'd also like to welcome the Dominican Republic representative. I bring to the attention of the committee document CE 174/1 and CE 174/WP. And now I give the floor to the Secretary, Ms. Mary Lou Valdez, to introduce this item.
Thank you, Madam President. In accordance with Rule 9 of the Rules of Procedure, the Executive Committee shall adopt its own agenda, and in doing so, may make such additions or modifications to the provisional agenda as they may wish, in accordance with these rules. Thank you, Madam President.
Muchas gracias.
Thank you very much, and I now open the floor for comments.
Si no hay oposición,
Should there be no objections, then we consider the agenda as adopted. Should there be a proposed inclusion, additional?
perdón. Bien. Ahora me permita.
Please allow me to bring to your attention the preliminary program of meetings. Madam Secretary, I'd be very grateful if you could introduce this proposal.
Thank you, Madam President. I would like to bring to the committee's attention document CE 174/WP, the preliminary program of meetings, which has been prepared to facilitate the work of the Executive Committee. And it states, while it is not a statutory requirement to adopt a program of meetings, it has been found to be a useful guide for participants and the Secretariat. Let me just keep going. The proposed hours of work of the Executive Committee will be from 9 a.m. to 12:30 p.m. and from 2 p.m. to 5:30 p.m. Monday through Friday. Please note that the committee will examine 44 agenda items and 16 proposed resolutions. Thank you, Madam President.
Muchas gracias.
Thank you very much. I give the floor to the members of the committee. Floor is open for comments.
Si no hay objeción.
Should there be no objection, we take the preliminary program of meetings as adopted. We move on to agenda item 3.1, report on the 18th session of the Subcommittee on Program, Budget, and Administration. I bring it to the attention of the committee document CE 174/4, and for that I call on Dr. Carlos Alvarenga, delegate from El Salvador, a country that was the president of the 17th session of the SPBA that was held on the 20th and 21st of May this year, to introduce that report.
Buenos días, señora presidenta.
Good morning, Madam President, Director Barbosa, delegates. It is an honor for me to report on the activities of the SPBA, the Subcommittee on Program, Budget, and Administration, that held its 18th session here at PAHO headquarters on 20th and 21st of March of this year. The delegates from the following countries and members of the subcommittee participated: Argentina, Bahamas, Costa Rica, Ecuador, El Salvador, the US of A, and Jamaica. As observers, we had the delegates from Brazil, Canada, Colombia, Cuba, Spain, Guyana, Mexico, Panama, Dominican Republic, and Uruguay. My country, El Salvador, was elected to act as chair of the subcommittee, Bahamas for the rapporteurship. The subcommittee dealt with important financial administrative matters as well as others. Amongst this, an overview of the financial report of the director corresponding to 2023, and an outline of the end of a biennium assessment of the PAHO program budget for 2022-2023, which will also serve as a second interim report on the implementation of the strategic plan, PAHO Strategic Plan 2020-2025. The subcommittee also discussed the proposals for the use of the budget and revenue surpluses remaining from 2022-2023 biennium, and heard reports on human resources management, the status of the Master Capital Investment Fund, the charge assessed on the procurement of public health supplies for member states, and the status of the Latin American Center for Perinatology, Women and Reproductive Health. All of the items discussed by the subcommittee are also included on the agenda for this session of the Executive Committee, and I will be reporting on each one of them as they're taken up by the committee. We thus conclude this part of my report. Thank you, Madam President. Thank you very much, distinguished delegate of El Salvador. I now give the floor to the delegates.
No viendo comentarios.
Seeing no request for the floor, having no comments, distinguished director, any comment? Well, thank you very much. I'd like to let the committee know that the debate will be reflected in the final report, and we move on to the next item on the agenda. Agenda item 5.1, report on the collection of assessed contributions. I bring to the attention of the committee document CE 174/21, add 1 as well, and I call on Mr. Christos Casapantonio, Director of Financial Resource and Management Department of the Pan American Sanitary Bureau, to please come up to the head table and introduce this agenda item.
Thank you, Madam President. Point 5.1, status of assessed contributions. Madam President, Director, and members of the Executive Committee, the assessments from Member States constitute a significant part of the resources supporting the organization's biennial program and budget. Prompt payment of both the accumulated arrears and the current 2024 assessments is imperative for the organization to efficiently implement the full program of work. The total assessed contributions due on June 24, 2024 was 77 million. As you see in the last bar, as of May, the balance was 91 million, but of course we had a payment of 14 million from the United States, which are grateful for the payment, and the balance has been reduced as of 24th of as of today to 77. 11 have paid the assessed contributions in full, 11 members. 9 have made partial payments. However, 21 members have not made any payments towards the 2024 assessed contributions. One member state owes assessed contributions since 2017. This member state is in arrears such that it is subject to Article 6B of the Constitution of the Pan-American Health Organization. It has arrears totaling $16.2 million in assessed contributions. As of May 31, of the organization had to access $16.5 million of the Working Capital Fund in order to meet commitments of the assessed contribution budget. The organization looks forward to receiving the balance of assessed contributions in a timely manner in order to implement fully the biennial program of the work approved by the member states. Thank you, Madam President.
Muchas gracias, señor.
Thank you very much, Mr. Casapantonio. The Executive Committee is invited to take note of this report and consider the possibility of adopting the proposed resolution presented in Annex C. I now open the floor to the plenary for discussion on the document presented.
Jamaica tiene la palabra.
Jamaica is recognized.
Dunstan Bryan, Jamaica. Thank you, Madam President. Chair, sorry. Chair, Jamaica wishes to thank PAHO for this comprehensive report on the assessed contributions due as at December 2023 and May 2024, respectively. We note with concern that despite the organization's appeal for timely payments, over 91 million now adjusted is still outstanding for 2024. Almost 6 million for 2022 and almost 13 million for 2023. As at May 2024, the countries have significant outstanding balances which will impact the overall effectiveness and efficiency of the organization. Left with no alternative, PAHO has so far used almost a third of its available cash balance in the Working Capital Fund. And if this fund is allowed to deplete, the biennial program of work may suffer serious setbacks. Given the aforementioned, Jamaica joins the organization in appealing to member states in arrears to settle immediately, as any further delay could have serious implications for national and regional health targets and programs. Having reviewed the proposed resolution, Jamaica offers no objection to its adoption, as we stand in solidarity with the organization. Thank you.
Thank you very much, Jamaica. I give the floor to the representative of Argentina. Thank you very much, Republic of Argentina. Argentina is fully committed to PAHO, and despite the macroeconomic straits that our country is going through, is currently undertaking great efforts to meet our pending obligations. We're fully aware of the fact that falling behind in the collection of contributions does have an impact on this organization's ability to do its work. Now, within a context of economic recovery and challenges that we are facing, we reassert our commitment to this organization, and we hope to be able to continue making our payments to be in fulfillment of our obligations. Thank you very much.
Gracias a la representante.
I thank the representative of Argentina. There not being any other comments, I give the floor to Mr. Casampantano.
And also the comments from the representatives of Jamaica and Argentina for the support of completing the payments in arrears and paying the dues, noting the difficulties of Argentina and other countries and the commitment to pay. Thank you.
I thank you for your comments. President or Director, do you have any comments?
You clearly can see in the graphic about the collected assessed contribution that last year, even recognizing the economic complex situations in many countries, we received almost 140 million. So I think that it was a very important demonstration about the commitment of our member states to keep PAHO fit for purpose, working, delivering technical cooperation. I think that I also want to thank both Jamaica and Argentina for their comments and how important it is to keep the same commitment this year. We have approved a very important strengthen in many country offices in the region, trying to expedite the process to deliver a better technical cooperation, and for sure that to keep the organization running well, we really needed the same level of commitment that our member states demonstrated last year, this year of 2024. So I expect to have soon all the countries making their payments so the organization can have all the activities programmed for this year, next year, during this biennial fully financed. Thank you, Madam President.
Thank you, Dr. Barbosa. Now, I would ask the rapporteur to present the draft resolution, proposed resolution. Proposed resolution. Collection of assessed contributions. The 174th session of the Executive Committee. Preambular paragraph 1. Having considered the report on the collection of assessed contributions, document CE 174/21 and addendum 1, presented by the Director. Preambular paragraph 2. Noting the current financial stress the Pan American Health Organization is facing as a result of the delay in receipt of assessed contributions. PP3. Noting that the Bolivarian Republic of Venezuela is in arrears in the payment of its assessed contributions to the extent that it is subject to the application of Article 6B of the Constitution of the Pan American Health Organization. PP4. Noting that as of 24th of June 2024, 21 member states have not made any payments toward their 2024 assessments. Resolves. Operative paragraph 1. To take note of the report of the collection of assessed contributions, document CE 174/21 and addendum 1, presented by the Director. Operative paragraph 2, to commend the member states for their commitment in meeting their financial obligations to the organization by making efforts to pay their outstanding arrears of contributions. OP3, to thank the member states that have already made payments for 2024. Operative paragraph 4, to strongly urge the other member states to pay all their outstanding contributions as soon as possible to mitigate any impact on technical cooperation activities. OP5, to request the Director to continue to inform the member states of any balances due and to report to the 61st Directing Council on the status of the collection of assessed contributions. Thank you, Madam President. Thank you, Rapporteur. I give the floor, or open the floor, to start this debate. There not being any objections, this resolution is adopted.
Bueno, vamos a continuar ahora con el punto 4.2.
Now, 4.2, strategy and plan of action to decrease the burden of sepsis through an integrated approach 2025-2029. I call to the committee's intention document CE 174/13. And I invite Dr. Sylvain Aldigieri, Director of the Department of Communicable Disease Prevention, Control, and Elimination of the Pan American Sanitary Bureau, to come to the head table and present the item.
Delegates, Director, and colleagues, I'm pleased to introduce the strategy and plan of action to decrease the burden of sepsis through an integrated approach for the period 2025-2029. The strategy and plan of action provides strategic and technical guidance to member states of the Pan American Health Organization on strengthening health services and systems to address sepsis through a wide range of interventions. Despite advances in medical science, sepsis remains a challenging condition to diagnose and manage effectively. It contributes to millions of deaths each year, making it a significant public health concern. The time-sensitive nature of sepsis, where delays in recognition and treatment can significantly worsen outcomes, underscores the need for heightened awareness and rapid coordinated care. The interplay of factors such as antimicrobial resistance, the emergence of new pathogens, and healthcare-associated infections further complicates the scenario, calling for a robust, integrated strategy to tackle this threat. In this context, the Secretariat carried out 2 rounds of regional consultations, first with experts from scientific societies from Latin America and the Caribbean, and with Ministries of Health technical teams from 20 member states. The strategy and plan of action have been developed through a coordinated, multifaceted approach, emphasizing multidisciplinary collaboration, equitable access to health services and medicines, and improved evidence-based decision-making while embracing innovations in the field of sepsis management and adapting to new challenges. This approach was shaped with input from multidisciplinary working group, including health systems, emergency departments, maternal and neonatal health, and access to medicines and technologies, and benefited from contribution and comments from member states and partners such as the Global Sepsis Alliance and the Latin American Sepsis Institute. This strategy aims to reduce the burden of sepsis across the Americas through a comprehensive and collaborative approach, ultimately saving lives and improving health outcomes for all populations. This document, which comprises 3 strategic lines of action, focuses on addressing inequities in healthcare and the needs of specific populations, such as neonates, children, and women. The 3 strategic lines of actions are the following. First, foundations for high-impact interventions, with enhancing awareness and strengthening research and surveillance to better understand sepsis epidemiology and burden. Second, prevention, in order to reduce the incidence of infections by improving vaccination, sanitation, and nutrition programs, strengthen hygiene practices, and implement effective infection prevention and control programs. Third, equitable access to appropriate health care, with ensuring prompt and accurate sepsis diagnostic and treatment by guaranteeing comprehensive quality control of antimicrobials, optimize supply chain management at all care levels, and bolster reference centers with adequate capacity for the expedited referral of patients. This approach is multifaceted, relying on enhanced surveillance systems, ongoing research to inform practice, and widespread awareness campaigns to educate both healthcare professionals and the public about sepsis prevention and management. The plan of action includes indicators that are already measured and/or aligned with existing mandates or strategic plans. After endorsement by the Directing Council, the Secretariat will develop implementation plans and provide technical cooperation to countries, creating an opportunity for the implementation of the PAHO WHO guidelines. The strategy and plan of action is to be implemented over a 5-year time frame from 2025 to 2029. Madam President, Director, distinguished delegates, thank you for your attention.
Thank you, Dr. Alugieri. The Executive Committee is invited to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in Annex A. I will now open the floor to the plenary for discussion on the document presented. Jamaica has the floor.
Thank you, Madam President. Dunstan Bryan, Jamaica. Jamaica commends PAHO on the development of a strategy and plan of action to decrease the burden of sepsis over the period 2025 to 2029, using a range of infection prevention measures as well as sepsis education for healthcare workers and others. Sepsis is the final common pathway to death for severe infectious diseases, including bacterial bloodstream infections, diarrheal disease, lower respiratory tract infections, malaria, dengue, and systemic fungal infections. Preventing infection is therefore the most effective way to prevent sepsis and reduce the burden of the disease. Jamaica continues to work towards achieving the minimum requirements for infection prevention and control programs at the national and healthcare facility level. There has been a thrust to build the capacity of infection prevention and control professionals at all levels and develop additional policies to demonstrate good infection prevention and control practices. We note strategic line of action 1 covers this crucial area, but additional resources will be needed for more targeted sepsis research and education. With respect to strategic lines of action 2, we believe that infection prevention and control activities must be integrated and aligned with other key programs such as antimicrobial resistance, patient safety, water, sanitation and hygiene, and health emergency programs, as well as HIV, tuberculosis, malaria, and maternal and child health. This is in order to emphasize the horizontal nature of infection prevention and control and to avoid duplication or vertical implementation. Infection prevention and control is already considered as a component of the National Preparedness, Readiness, and Response Plan within the context of public health emergencies in Jamaica, but would require some building out to support sepsis prevention. Strategic Line of Action 3 addresses timely diagnosis and treatment of the disease and calls for the development of generic clinical protocol and tools for the rapid recognition and management of sepsis, as well as routine auditing. While Jamaica maintains the strong political commitment needed to drive and improve implementation of a functional infection prevention and control program, which encompasses sepsis, the challenge remains the sustained action in order to ensure incorporation into relevant plans and budgets. Also, technical support is needed as no infection prevention and control country capacity currently exists. Jamaica is committed to implementing the strategy and plan of action and look forward to PAHO's continued support in all areas. We are also pleased to register our support for the adoption of the proposed resolution. Thank you.
Thank you, Jamaica. I give the floor to Chile. Thank you very much, Madam President, and good morning, everyone. This strategic line for Chile stands out as being something quite valuable to our country. The existence of a national program for infection control is in place, has been in place since 1983 with the support of this organization. This plan or program is current. It's decentralized and operating throughout the country. We have mandatory compliance requirements from the health ministry down to each health establishment, whereby preventive and infection control measures are implemented in each one of these centers, and especially as regards those infections related to cardiovascular disease. Now, this, along with epidemiological surveillance of infections, which is carried out in each one of the country's hospitals, along with the ongoing oversight of the prevention and control measures at the centralized level, we have brought these infections down over time, as well as the lethality associated to them. For Chile, just as in the case of other countries of the region, sepsis is a health problem that leads to death and entails high costs for the healthcare system. This is why we fully believe that initiatives such as those presented in this document under review will strengthen public health, avoiding deaths and also other harms to society. Chile will continue developing these lines of action as described in the document under review. We would especially like to underscore that the National Infection Control Program has been in place for a long time and has had a real impact nationwide, and our challenge remains to keep it up and running. We are available to offer any assistance to this organization or countries of the region when necessary. Thank you very much, Madam President.
Muchas gracias, Chile.
Thank you, Chile. I give the floor now to the United States.
Thank you, Madam President. The United States thanks the Pan American Health Organization for its efforts to reduce morbidity and mortality due to sepsis in the Americas. This strategy and plan of action will be a critical tool informing countries' efforts to establish and implement interventions addressing sepsis by enhancing awareness, increasing surveillance, and strengthening community and healthcare infection prevention and control programs. This strategy is especially important for maternal and neonatal health, for which sepsis is negatively affecting morbidity and mortality rates. We urge member states to improve sepsis surveillance in adult, maternal, pediatric, and neonatal populations, provide resources to healthcare systems, facilities, and providers to improve sepsis detection and care, and conduct health and risk communications about sepsis. Standard definitions of sepsis and improved surveillance can be used to track the incidence of sepsis and sepsis outcomes over time and assess the impact and effect of interventions to reduce the sepsis burden. We urge member states to collaborate with partners to better understand the burden of sepsis by using standard definitions of sepsis and improving surveillance, including maternal, pediatric, and neonatal sepsis surveillance. We agree with the Pan American Health Organization that better data and improved research can help drive national improvements in prevention of infections that can lead to sepsis, as well as early identification and management of sepsis. And finally, we recognize that increased community and healthcare infection prevention and control efforts are critical to improving healthcare quality across the continuum of care. Having strong and effective infection prevention and control programs helps reduce the incidence of infections and can decrease sepsis cases. Thank you very much, Madam President.
Thank you, U.S. I give the floor to Brazil. Thank you, Madam President. It's a pleasure to see you as the President.
In this item is the critical relationship between sepsis and antimicrobial resistance. Resistant infections often lead to sepsis, complicating treatment and reducing its effectiveness. AMR hinders rapid infection control, increasing the risk of sepsis progression and mortality. Therefore, new antimicrobials and rapid diagnostics are essential to improve treatment outcomes. Controlling AMR is vital for effective sepsis prevention and treatment, and in line with the Global Action Plan on Antimicrobial Resistance adopted by the WHO and the 2015 Action Plan on Antimicrobial Resistance. Additionally, equitable access to medications and appropriate sepsis treatment must be enhanced following guidelines such as the Surviving Sepsis Campaign and the expansion of regional production capacities. Initiatives like public-private partnerships are crucial to ensure medication availability and promote the rational use of antimicrobials. Investments in research and development of new therapies are also necessary. A mention to the need of making medications available should be part of this strategy, and this is a suggestion that I'd like to put on the table. Annex B of the proposed resolution highlights a significant funding gap for the strategy and plan of action to reduce sepsis burden, which requires resource mobilization. We understand that. Brazilians wonder what activities the Secretariat plans to do in order to bridge this gap. Still, the baselines of 11 indicators are yet to be determined. How were the targets set in such cases? Brazil would like to fully endorse as an observer the strategy and the action plan to reduce the burden of sepsis. This endorsement stems from the strategy's comprehensive evidence-based approach aligned with Brazil's goals to enhance sepsis prevention, diagnosis, and treatment. Adding these international guidelines underscores Brazil's commitment to reduce sepsis burden, improve public health, and save lives. Thank you very much.
Thank you, Brazil. I offer the floor to Dr. Audigieri for him to respond to the comments.
Thank you, Madam Chair. I'd like to thank the delegation from Jamaica, Chile, the United States, and Brazil for their comments. We have carefully taken note of all the comments. I'd like to highlight a couple of points that were cross-cutting different interventions today. And following the comments from Jamaica and Brazil, the link between sepsis and the Global Action Plan on antimicrobial resistance is very strong. We have a burden of disease with an estimated 20% of maternal mortality related to sepsis and more than 25% of neonatal mortality linked to sepsis. So we have these objectives. Quisiera
I would like to underscore and stress the comments made by Chile regarding the need to keep up and bolster strong infectious control programs at all levels of health care services. Chile, as you said, has a long-standing experience in this, and thank you for your support.
The need for a better assessment, as mentioned by the delegation from the United States, a better assessment of a burden of sepsis, and the need for better data at regional level. And this is also linked to the question from the delegation from Brazil. We are in baseline in the process of collecting baseline data, and through other rounds of conferences and consultations with experts group, and this baseline data will be incorporated in the document to be submitted to the Directing Council. I'd like also to highlight the comments from the delegation of Brazil with access to a rapid diagnostic and also access to medication. And this is linked to the expansion of the regional production, which is also a PAHO priority. And I think these were the main cross-cutting comments from the four delegations today. Thanks a lot, Madam President.
Thank you, Dr. Aldighieri. Dr. Barbas, do you have any comments you would like to make? Yes, Madam President, I'll be brief. I would like to thank Jamaica, Chile, the U.S., and Brazil for your very important comments. This is a strategy and plan of action that I think is going to solve or address a very serious healthcare problem. As said by Dr. Aldighieri, the burden of sepsis is something that the other region is in many places not fully understood, because more surveillance has to be conducted to establish indicators for each country. But I do think that, without a doubt, the approval by this executive committee of this plan of action and strategy will help each country to better prepare and to respond to a very important public health problem, which is sepsis, in a comprehensive and integrated way, as all the countries have said, hand in hand with antimicrobial resistance measures. This is a very important step to bring to bear a better regional response, as well as in each country, to this very serious problem. Thank you very much, Madam President. Thank you, Dr. Jarbas Barbosa. I would ask the rapporteur to please present the proposed resolution. Thank you, Madam President. Proposed resolution. Strategy and plan of action to decrease the burden of sepsis through an integrated approach 2025-2029. The 174th session of the Executive Committee. Preambular paragraph. Having reviewed the proposed strategy and plan of action to decrease the burden of sepsis through an integrated approach 2025-2029, document CE 174/13 resolves, operative paragraph, to recommend that the 61st Directing Council adopt a resolution in the following terms. Strategy and plan of action to decrease the burden of sepsis through an integrated approach 2025-2029. The 61st Directing Council, preambular paragraph 1, having reviewed the proposed strategy and plan of action to decrease the burden of sepsis through an integrated approach 2025-2029, PP2, acknowledging the significant impact of sepsis on public health in the region of the Americas, which results in substantial morbidity, mortality, and socioeconomic burden, and which requires a coordinated multidisciplinary approach to effectively address its prevention, early detection, and clinical management. PP3, reaffirming the commitment to promoting universal health coverage and strengthening health systems to improve the response to sepsis at all levels of care. PP4, emphasizing the critical role of research and innovation in advancing and understanding of sepsis pathophysiology, diagnostics, and therapeutics. PP5, bearing in mind the goals and targets of the 2030 Agenda for Sustainable Development and the Sustainable Health Agenda for the Americas 2018-2030, which call for reducing the impact of infectious diseases and promoting rational use of safe, effective, and affordable medicines. Resolves, operative paragraph 1, to approve and implement the strategy and plan of action to decrease the burden of sepsis through an integrated approach 2025-2029. OP2, to urge all member states, considering their contexts, needs, vulnerabilities, and priorities, to A, elevate sepsis to a high-priority public health issue and integrate comprehensive strategies for its prevention, early detection, and clinical management into national health policies and plans. B, implement national strategies guided by the objectives outlined in this strategy and plan of action, and establish effective monitoring systems utilizing the recommended indicators. C, ensure the allocation of adequate resources for comprehensive sepsis prevention and clinical management programs with special attention to high-risk populations encompassing quality care, training, research, and public awareness campaigns. D, encourage national collaboration among the health, education, civil society, academic, and finance sectors for a unified approach to sepsis management, while also fostering international cooperation with various countries and organizations to exchange best practices, resources, and innovations in sepsis prevention and treatment. E, call for increased investment in research and development for innovative diagnostics, treatments, and preventive strategies for sepsis, including novel antimicrobial agents and immunotherapies and vaccines. Operative paragraph 3, to request the Director to provide technical cooperation to member states with a view to facilitating knowledge exchange to strengthen capacities that will contribute to the implementation of the strategy and plan of action. B, foster collaboration among member states to enhance execution of this plan of action, adapting it to various sub-regional and national contexts and priorities. C, bolster partnerships with civil society organizations and patient advocacy groups to raise awareness, mobilize communities, and include patient perspectives in policy development and program implementation related to sepsis. D, report periodically to the governing bodies of the Pan American Health Organization on the progress made and challenges faced in the implementation of the plan of action through a mid-term review in 2027 and a final report in 2030. Thank you, Madam President. Thank you, Mr. Rapporteur. I give the floor to the plenary.
Muy bien.
Very good. So this resolution stands adopted.
Bueno, como hemos tenido
Since we've worked hard this morning, from the very beginning of today until now, I invite you to go have some coffee, talk amongst ourselves, chat a little bit, and we'll come back in half an hour. 10:30, we'll be back in the room to reconvene. Thank you.
AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Over the past year, PAHO has made significant strides in fostering an evaluation culture and practice to increase effectiveness, efficiency, transparency, and accountability of its work. See some of the main goals PAHO has reached so far. 5 major evaluations conducted and ongoing. 3 of them are published, including the evaluation of PAHO's response to COVID-19. The first evaluation of the kind among all WHO regions, creation of a repository gathering all evaluation evidence in PAHO for enhanced institutional memory and learning, personnel capacity building in evaluation practices, launch of PAHO's evaluation external website for increased transparency and accountability, more than 30 recommendations from evaluations being implemented and tracked through the new evaluation platform. How has your work been informed by evaluation? Join us on this journey of continuous improvement as PAHO works to evolve and achieve better results through evaluation and learning.
Buenas. Hola Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está? Pues todo bien. En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica asistorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ya se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se les solicita a la voluntaria de salud y a la
paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo. Les damos charlas a las madres como cuando identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria.
9 meses del embarazo, desde allí estoy yo pendiente. Estoy con el celular, me llamo. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora, 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso y apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos amizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población en la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto pues, fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándole capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. El presupuesto que nos permita adaptar y continuar algunas de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Estamos en Puerto Inírida, Guainía, la triple frontera con Venezuela y Brasil, para el lanzamiento de la Semana de la Vacunación de las Américas. Buscamos reforzar la importancia de las vacunas. Las vacunas son seguras, eficientes y nos ayudan a prevenir enfermedades, así como también a salvar vidas.
Dándoles pues la bienvenida, dándole la bendición, que eso es lo que siempre hemos soñado en nuestro departamento, que llegue la salud a territorio.
La Organización Panamericana de la Salud, que está conformada por todos los países de la región de las Américas, hace un esfuerzo único para poder incrementar las coberturas de vacunación. Desde su secretariado, la Oficina Sanitaria Panamericana, trabajamos mano a mano con cada uno de los territorios, en este caso en Colombia, para poder llegar a los municipios más alejados, llegar a esas comunidades indígenas, a las poblaciones afrodescendentes, a las diferentes etnias, llevando las vacunas y también otros servicios para proteger la salud y el bienestar de los pobladores.
Y gran parte de nuestra población se encuentra ubicada en zona rural y rural dispersa. Entonces, el acceso ya se ha convertido en una de las cosas más importantes para el programa, y es, así como los niños de las ciudades reciben la vacuna, poder llegar a esos niños tan alejados y que están en una situación, hay veces de vulnerabilidad, en donde hay mayor riesgo de enfermar, ya sea porque no se tienen una mala nutrición. Entonces las vacunas ayudan a ese sistema inmunológico para que se desarrolle y no se enferme, porque la probabilidad de que pueda morir, por ejemplo, por un sarampión y además de una persona desnutrida, aumenta la probabilidad. Entonces, el vacunar a esa población susceptible y que está alejada y muy vulnerable es de vital importancia para nosotros en esta jornada de Semana de Vacunación en las Américas. Hacemos un mayor énfasis en estos territorios vulnerables para que podamos de alguna manera utilizar estrategias para poder llegar a esta población que está más alejada y, como mencionaba, que vive en zona fronteriza y que vive en zona rural dispersa. Entonces, muchas veces lo que hacen las entidades territoriales y las secretarías de salud y las IPS que realizan estas actividades es realizar recorridos por las comunidades que viven cercanas a los ríos y que además están en frontera. Entonces nosotros debemos hacerles saber a la población que ellos son beneficiados por esto, que deben pedir y deben luchar por ese derecho que tienen hacia vacunar. Es un derecho que tienen los niños y deben exigirlo, deben exigir la vacunación.
Y por eso hay que comenzar desde la base. Estos equipos tienen que ir a atender las necesidades de cada una de las comunidades.
Algunas comunidades, algunas etnias pues no entienden pues lo que son las vacunas, pero ahí vamos paso a paso y pues que dejen de vacunar a los niños para que en el futuro pues no les den las enfermedades por las cuales pues estamos vacunando.
La jornada para nosotros ha sido productiva. Hemos encontrado algunos niños para vacunación. Hemos realizado la respectiva vacunación y además sí se presta para seguir administrando las próximas dosis.
Reafirmar que las vacunas son seguras, las vacunas son eficaces, nos permiten prevenir enfermedades y salvar vidas y las vacunas son gratuitas. Colombia ha hecho una gran inversión en el programa ampliado de inmunizaciones, tiene 21 vacunas para 26 enfermedades y son gratuitas para todos los proveedores en el territorio. En Colombia no hay barreras para la vacunación. Lleven la voz, hagan que cada miembro de su comunidad esté vacunado, protegido contra las enfermedades. Muchas gracias.
Para nosotros, la captura de pequeños mamíferos es importante para identificar diferentes patógenos. En algunas ocasiones colocamos redes para capturar murciélagos, extraemos muestras de sangre, muestras de tejido para llevarlas al laboratorio y luego entonces identificar estos pequeños mamíferos y sus patógenos que nos pueden causar algún problema de salud. El mayor problema en los murciélagos sería la rabia, que es una enfermedad que no es muy estudiada en diferentes lugares. Si hay un caso de alguna persona infectada por Hanca, tenemos que buscar entonces los sitios adecuados para poder colocar las trampas, y principalmente la vivienda de la persona, los sitios donde habitualmente circula la persona, si es un área de cultivo, si es el patio de la casa, para aumentar el interés de poder capturar los animales que queremos.
La OPS está desarrollando una iniciativa en conjunto con el CDC, con el Instituto Nacional de Enfermedades Virales Hemorrágicas y el Instituto Gorgas, para diseñar un taller que permita hacer la transferencia en el manejo de potenciales enfermedades zoonóticas que algunas conocemos, otras son desconocidas, como por ejemplo hantavirus y adenavirus, que ha afectado en diferentes regiones de las Américas, como Bolivia, como Argentina, Venezuela, en relación a adenavirus o hantavirus.
Bueno, muy buenos días de nuevo a todos.
I hope you all enjoyed your break. Welcome back. These breaks are so nice because we get a chance to talk. And it gives us an opportunity to exchange in a more relaxed way. So, forging ahead with today's agenda. Now, turning to item 4.3, policy for strengthening health sector action on climate change with equity. I would like to call to the committee's attention document CE 174/14 and invite Dr. Jerry Ackermans, I hope I pronounced your name correctly, Director of the Department of Social and Environmental Determinants for Health Equity of the Pan American Sanitary Bureau, to come to the head table and present the item.
Madam President, Director, distinguished delegates of the 174th Executive Committee, colleagues, climate change is a major global health threat affecting health, well-being and health equity. Direct impacts to health include heat waves, drought, heavy storms and sea level rise, while indirect impacts include a rise in vector-borne diseases, food and water insecurity, undernutrition and forced displacements, amongst others. The Americas is one of the most vulnerable regions due to its susceptibility to extreme weather events and reliance on climate-sensitive sectors. And importantly, climate change threatens to exacerbate the already significant health inequities in this region, affecting populations and territories in situation of vulnerability, including small island development states, disproportionately. The health sector needs to take immediate and decisive action on climate change and health, with specific efforts to integrate an equity focus into the adaptation and mitigation measures. Despite the urgency, progress has been uneven across the region due to barriers such as limited awareness, inadequate resources, lack of intersectoral action and community engagement, and insufficient action on social and environmental determinants of health. The policy presented today sets out a course of action and a strategic framework to strengthen the health sector action on climate change with equity, and is structured in 5 lines of action to enable the health sector to address current and future hazards posed by climate change to health, well-being and health equity. 1 is to strengthen the health sector's capacity for adaptation, to anticipate, prevent, prepare for, respond to and recover from the impacts of climate change while reducing health inequities. This includes strengthening and implementing climate and health adaptation plans at national, subnational and local levels through enhanced intersectoral action. It also focuses on ensuring that health facilities continue to function during crisis. Number 2 is to strengthen the capacities of the health sector for mitigation, to build low-carbon health systems and societies, aimed at achieving health co-benefits and reducing health inequities. This calls for simultaneously greening the health sector and implementing policy to cut societal greenhouse gas emissions while generating health and equity co-benefits. Number 3 is to create awareness and to strengthen community and civil society engagement on climate change and health equity using a climate justice approach. This underscores the importance of inclusive policies and active involvement of communities and civil society in decision-making processes. Number 4 is to improve the surveillance of climate change and health and the generation and the use of evidence for the design and implementation of adaptation and mitigation strategies that protect health and reduce health inequities. This surveillance relies on enhanced intersectoral cooperation to integrate data from various sectors. And finally, number 5, to increase health sector financing for climate change adaptation and mitigation with an emphasis on populations in situation of vulnerability, prioritizing funding, engaging diverse stakeholders, and ensuring sustainable investments are essential for the health sector's efforts in climate adaptation and mitigation. This policy builds on existing global and regional agreements, policies and strategies, and is aligned with the recently approved WHO resolution on climate change and health, as well as with the new WHO Global Programme of Work, which has put a strong component on climate change and health. The policy also aligns with other items that are being presented today and during this week during the Executive Committee. The policy we are presenting went through an extensive consultation process, including 2 virtual and a written consultation, and we thank the Member States for your active engagement in these processes. We invite you to review the document and consider approving the proposed resolution. Thank you very much.
Thank you. I invite the Executive Committee to review the information that's been submitted in this document and to consider the possibility of approving the proposed resolution presented in Annex A. I will now open the floor to the plenary for discussion on the document presented.
Chile tiene la palabra.
Chile is recognized. Thank you very much, Madam President. I'm grateful for the document that the organization has presented on such an important topic that is of particular importance to Chile, given our geographic location. Chile is very much aware of the challenge that climate change poses to the health of our region. We have most of the factors of vulnerability that have been identified by the UN Climate Change Panel regarding health effects of climate change. Our country, in 2014, at an early stage, had already defined a national plan of adaptation to climate change as an instrument to bring together our public policy by way of adapting to climate change. In 2017, we also defined a national plan of action for climate change with its pillars of mitigation and adaptation. It's within this framework that in 2016, the healthcare sector established the first plan for adaptation for the health sector that is currently being overhauled or updated, and now we are working on a sectoral mitigation plan. That means we are already talking about mitigating the impact of climate change. Still, when you look at all the things that have to be done nationwide to address climate change, the healthcare's perspective is no easy thing when considering internal and external factors that play into these actions in health, which we have prioritized, but that are difficult to obtain now. For sustainable development and equity, this isn't something that's always been fully understood, and that is why our country sees how important this proposal is for there to be a policy to strengthen the health sector's approach to climate change. Given what has been said and considering the cross-cutting nature of this proposed policy, this could be a bridge between the climate change and health approach, sustainable development, and the protection of biodiversity, conservation, social determinants of health, and equity in health. Chile fully supports this proposed resolution to strengthen health sector action on climate change with equity proposed by the Pan American Health Organization. Thank you very much, Madam President. Thank you, Chile. I give the floor to Brazil. Thank you, Madam President.
Change must be at the heart of the public health agenda in these days. We support the adoption as observers of this draft resolution. The policy correctly highlights a number of dimensions that are vital, including human rights and social participation. We observe with great concern the impacts of climate change due to the abrupt increase in risks to human health, including the proliferation of diseases, the risk of accidents, unsanitary conditions, and the lack of urgent and emergency care. This scenario further highlights the need for public health systems to be adapted and strengthened to achieve greater resilience to the effects of climate change. In the southern state of Rio Grande do Sul, we are facing the devastating effects of extreme weather-related events, which led to catastrophic floods and landslides. These events impacted healthcare facilities, hospitals, and specialized health centers that may experience long-lasting operational difficulties. Climate change affects all countries indiscriminately. However, it disproportionately reproduces and may increase inequalities within and between countries. Unfortunately, in the face of public health emergencies, it's important to highlight that the most vulnerable populations are more affected by the impacts of climate change, such as residents in peripheral areas, indigenous peoples, traditional communities, and people with low mobility, among other aspects. Therefore, it's necessary to implement measures that focus on providing more equitable attention to the population as a whole. Climate justice is a key concept to the success of this policy. We also would like to highlight that the work by the Secretariat should not be limited to the traditional technical cooperation, which is bilateral in nature. It should involve regional, sub-regional, and national initiatives, including seminars, to build capacities and raise awareness. It should also facilitate mobilizing resources for state-driven national level projects. Thus, we understand that to address the climate challenges impacting human health, intersectoral actions for mitigation and adaptation in the health sector, along with social participation and promotion of a just transition, technology exchange, and capacity building, are strategic means to advance globally and regionally in ensuring fair and equitable health. Thank you.
Thank you, Brazil. I give the floor to the U.S.
Thank you, Madam President. The United States appreciates the development of the proposed policy for strengthening health sector action on climate change with equity. We are heartened to see the continued momentum on health and climate following the COP28 Health Day, including the recently adopted WHO resolution on climate change and health, and this proposed resolution. The United States supports climate change, adaptation, and mitigation efforts, including efforts that prioritize the health needs of the most vulnerable populations in fragile, conflict-affected, and vulnerable contexts. In recognition of the policy's focus, we recommend using the phrase health equity throughout. While we are appreciative of the development of this policy, we do have significant concerns with some of the language and would propose edits to the text of the report and resolution for the committee's consideration. In paragraph 2, we request the deletion of the following sentence. It is important to ensure that those who contribute and have contributed most to the problem bear a proportional share of those efforts and costs. This could be replaced with, it is important to mobilize and increase the flow of public, private, and donor funding and ensure access to finance to support these efforts and costs. Within the title of Line of Action 3 and paragraphs 21 and 22, we would also like to request the deletion of the phrase climate justice, as there is not a mutually agreed upon definition. Finally, on paragraph 27, we would like to propose the deletion of the sentence, there is also a need for financial support that is proportional to the historic, current, and projected greenhouse gas emissions. We are not authorized to approve this language and have alternative language to suggest. We are working to offer alternative language in regards to the above edits and have several additional edits which we will submit in writing. Thank you.
Thank you, U.S. I give the floor to Canada.
Gracias. Canada thanks PAHO very much for this important policy addressing the critical need for the health sector to proactively respond to the impacts of climate change on health. Recognizing, of course, that climate change is having serious effects on the health sector and population health, with disproportionate impacts on those living in vulnerable and marginalized situations, we fully support putting equity at the forefront of our collective efforts. We appreciate PAHO's early consultations, and we do look forward to hearing from our colleague member states and to the U.S. Future edits that are coming. But we really look forward to coming to a consensus today on both the policy and the resolution. We do have a couple of recommendations, specifically regarding the framing of the language around nationally determined contributions, so NDCs. Given these are not general planning tools that are equivalent to vulnerability and adaptation assessments or health national adaptation plans. We're looking at Article 4 of the Paris Agreement, where NCDs are first and foremost greenhouse gas mitigation targets. That said, we fully agree that there are significant opportunities here to advance a more synergistic approach to policies and processes for addressing climate change and improving health. As reflected in COP28's Declaration on Climate and Health, countries should indeed pursue better integration of health considerations in developing their next NDCs, as well as long-term low greenhouse gas emission development strategies, national adaptation plans, and adaptation communications. These changes that we propose really only aim to avoid mischaracterization, great word, of NDCs, while still reflecting the opportunity and the importance of countries pursuing better integration of health consideration in developing their next NDCs. On that, we would agree, we have alternate language, of course, to still reflect the idea of the NDCs. We would recommend deleting in paras 14 and 16 the reference to NDCs, and we have a proposed language that we would propose adding in 16, and maybe we'll just do that in writing after, since others are coming, and save time. Finally, we would also just propose a friendly amendment to the second sentence of paragraph 25 to include sex disaggregation of data, for which we know collection and use of this data is critical in providing a more accurate and complete representation of individual experiences to inform effective action. So in 25, we would recommend adding to the list improved data collection, data quality, sex disaggregation, standardization, and it continues. Thank you very much. Merci.
Thank you, Canada. I give the floor to Colombia. Thank you, Madam President, and good morning, everyone. We are very grateful for the presentation of policy for strengthening the health sector action and climate change with equity, and we support the 5 lines of action that have been proposed in this plan. Colombia underscores this theme as one of the main ones in our agenda, mindful of the fact that our National Development Plan has identified climate change management as a key aspect. Our country, in keeping with the 2021 approved line of action, has adopted a number of models to adaptation to climate change as relates to health, to formulate disease prevention actions for health, reducing the climate change-related diseases, and also adaptation vis-a-vis, that is, diseases resulting from climate variability. These goals are in line with the proposed lines of actions in this current proposed plan. We also think it's important to underscore that climate change is the biggest challenge faced by mankind, threatening human existence itself, energy transition that would reduce the emissions of greenhouse gases is important, especially protecting very important areas such as the Amazon region, which are essential to climate stability and have bearing on health. We also think it's important for the policy presented, the fact that it also favors exchange of knowledge and experiences from the different venues such as attach, and will have bearing on decisions adopted in subsequent COP meetings, such as the one to be held in Brazil. We urge all member countries to take part in October 21st to the 1st of November in Cali, Colombia, a meeting that will be focusing on climate change from the health perspective. This is going to be very important for us to continue to find solutions contributing to enhance health of our inhabitants. Thank you. Thank you, Colombia.
I now call on Dr. Eichmann to respond to these comments.
Much for the comments from Chile, Brazil, the US, Canada, and Colombia. Thank you very much for the support that you expressed for this policy and this resolution. We hear a couple of things that I would like to highlight. We know that positioning health is not easy on the climate change agenda, and I think this was highlighted by several. This is something we all have in common. we also hear that we are ready, and my condolences, our condolences for what's happening in Brazil and in other places of this region at this moment, where we have already seeing the very heavy impacts of climate change and weather on the populations. I also welcome the comments around the regional, sub-regional and national collaboration and the opportunities that we're having to go beyond our regular technical cooperation efforts. And I think very much to everybody who has mentioned the importance of having an equity focus in this climate change adaptation and mitigation agenda. Putting a special emphasis on populations in situation of vulnerability, populations in territories that are particularly vulnerable. I would like to, we welcome, of course, the comments that we are going to receive from the US and from Canada in writing, and acknowledge what you have already mentioned in terms of necessary or requested changes in the documents. So thank you again very much for all your comments and your support. And we will pass the floor back to the President.
Muchas gracias. Invito.
Thank you very much. Dr. Barbosa, any comments?
Thank you, Madam Chair. I also want to thank our member states that have made so relevant comments, contributions to the resolution, that the document in the resolution on policy for strengthening health sector action on climate change with equity. I fully agree with the member states that they have highlighted how important it is to have the equity concept on this resolution, because not only the most vulnerable countries, but also the most vulnerable population with the countries are heavily affected by climate change. I think that there are some proposals to change the document, so I think that probably the member states will need more time to discuss it, to see if there is a consensus about this change, and to come with a document that can be accepted by all member states. So I really appreciate this is part of the process to discuss. It's a very complex issue. And I think that at the same time, that's very important to strengthen our capacity to provide the technical cooperation to the countries and to interact with other mechanisms in the region in order to have health as a very important part of the climate change agenda in the Americas. Thank you, Madam Chair.
Muchas gracias, doctor.
Thank you very much, Dr. Barbosa. And now I ask the rapporteur to present the proposed resolution. Thank you, Madam Chair. Proposed resolution. Policy for strengthening health sector action on climate change with equity. The 174th session of the Executive Committee, PP. Having reviewed the policy for strengthening health sector action on climate change with equity, document CE 174/14, which sets out a framework for health adaptation and mitigation actions to address climate change and increase health equity. Resolves, OP, to recommend that the 61st Directing Council adopt a resolution in the following terms. Policy for strengthening health sector action on climate change with equity. The 61st Directing Council, PP1, having considered the policy for strengthening health sector action on climate change with equity, PP2, bearing in mind member states' commitments to the implementation of adaptation and mitigation actions to protect the health of the populations from the impacts of climate change, PP3, recognizing that climate risks threaten societal foundations in the region of the Americas and considering the urgent need to implement adaptation and mitigation measures that can anticipate, respond to, cope with, recover from, and adapt to climate-related shocks and improve the health of the population, PP4. Understanding that health sector emissions also contribute to climate change and acknowledging the need to curb emissions and reduce waste in the health sector with decarbonization targets and procurement standards for national health systems, including supply chains. PP5, considering that policies and interventions on adaptation and mitigation must be designed with social participation and should aim to reduce health inequities and protect those in situations of vulnerability, including women and girls in all their diversity. PP6, recognizing the cross-cutting nature of this policy, which serves as a bridge between agendas of climate change and health, sustainable development, biodiversity protection, conservation, social determinants of health, and health equity, building upon global and regional agreements, strategies, and initiatives, resolves OP1 to approve the policy for strengthening health sector action on climate change with equity. OP2 to urge all member states, considering their context, needs, vulnerabilities, and priorities, to A, promote the implementation of the lines of action contained in the policy for strengthening health sector action on climate change with equity. B, strengthen the health sector's capacity for adaptation to anticipate, prevent, prepare for, respond to, and recover from the impacts of climate change while reducing health inequities. C, strengthen the capacities of the health sector for mitigation to build low-carbon health systems and societies aimed at achieving health co-benefits and reducing health inequities. D, create awareness and strengthen community and civil society participation on climate change and health equity using a climate justice approach. E, improve the surveillance of climate change and health and the generation and use of evidence to inform the design and implementation of adaptation and mitigation strategies that protect health and reduce health inequities. F, increase health sector financing for climate change adaptation and mitigation with emphasis on populations in situations of vulnerability. OP3, to request the director to A, provide technical cooperation to member states to strengthen capacities that contribute to the implementation of the policy. B, report to the governing bodies of the Pan American Health Organization on the progress made and challenges faced in the implementation of this regional policy and its adaptation to specific context and needs through a progress report in 2029 and a final report in 2034. Thank you, Madam Chair. Thank you, distinguished rapporteur. I now offer the floor to begin the discussion.
Le damos la palabra a los...
We give the floor to the U.S.
Madam President, we have two proposed edits to the resolution. First, in Op 2A, we would request to insert equity to read as policy for strengthening health sector action on climate change with health equity. We also request Op 2D replace using a climate justice approach with furthering justice in climate change adaptation and mitigation. That is all. Thank you.
Muchas.
The U.S., would you be kind enough to repeat these requested changes, please?
In Op 2A, we would like to insert equity so that it reads policy for strengthening health sector action on climate change with health equity. And then on Op 2D, we would like to remove climate justice, using a climate justice approach, and replace it with furthering justice in climate change adaptation and mitigation.
Muchas gracias, Estados Unidos.
Thank you very much, U.S. Please give us a couple of minutes so that we can talk about the amendments suggested. Thank you.
Muchas gracias por el tiempo.
Thank you very much for allowing us this time. We wanted to ask you to please submit your proposals in writing. We also ask you to discuss this informally during our breaks and the time we have available until tomorrow so that states can talk about these proposed changes. And we'll come back to this tomorrow. If informally we arrive at a decision to the effect of including these changes, we shall continue. Should we not reach an informal agreement, then we will establish a formal mechanism in order to discuss this issue. So this is the invitation that we extend to you on this specific issue. Thank you.
Así que abrimos este tema.
So we'll come back to this agenda item tomorrow after that, these informal meetings that you will hold. And now let us move on to agenda item 4.4, Plan of Action for Strengthening Information Systems for Health, 2024-2030. I bring to the attention of the committee document CE 174/15, and I invite Dr. Sebastián García Saizó, Director of the Department of Evidence and Intelligence for Action and Health of the Pan American Sanitary Bureau, to please come to the head table and present this item.
Señora Presidenta del centésimo.
Madam President of the 174th session of the Executive Committee, distinguished members of the committee, distinguished director, colleagues. It is an honor for me to introduce the new Plan of Action for Strengthening Information Systems for Health 2024-2030, a key document for the development in the region within the context of an increasingly more digitized and hyper-connected society. This plan is a result of a collective effort together with all member states and key stakeholders whose development is based on lessons learned and the progress made during 2019 and 2023 through the IS4H strategy, because of its acronym in English, and whose final report will be submitted here. And within the framework of the roadmap for the transformation of the digital system adopted in 2021. Its development is a result of a discussion held within the 60th Directing Council held in 2023, pointing out to the need of renewing the previous plan and maintain priority actions. The document was developed within the context of a broad consultation process with all member states, which began in November 2023 at the Regional Relaxes meeting, with the participation of all countries and territories of the Americas, as well as 16 key partners that support this initiative, standing out the Inter-American Development Bank, the World Bank, the Spanish Cooperation, USAID, CDC, Inter alia, as well as a virtual session held in May this year with member states. As we know, the pandemic, the COVID-19 pandemic, has laid bare the importance of the digital sector and the need for having robust information systems, interconnected and interoperable. The information systems for health in our region face multiple challenges. The evaluation performed by the Pan American Health Organization between 2016 and 2023 showed that 48.2% of countries in the region are at the lowest maturity level, essentially using analog data and urgently needing digitalization. 34.7 are in level 2, introducing best practices, but still facing significant challenges in the integration and standardization of data. Only 18.4% of the countries has reached level 3, with standardized systems and in continuous ongoing improvement, while barely 4% is in level 4, with integrated systems and in keeping with international standards. No country has reached level 5, the highest level, which implies a complete integration and continuous innovation in information systems for health. It is within this context that the current plan is concentrated on the implementation of national strategies to manage data in an effective way, making decisions based on evidence to adopt new digital health solutions with good cost-effectiveness relation, improve the standards of legislation and human skills in order to expedite the digital transformation in the health sector. It covers information subsystems such as immunization, vaccination, epidemiological surveillance, communicable and non-communicable diseases, amongst other priority areas. It is expected that the plan will dramatically improve effectiveness, integrality, and the capacity to respond of health systems, prioritizing the first level of care as a basis in order to strengthen systems. The new plan is based on 4 strategic lines of action focused on strengthening management and governance of information systems for health, thus ensuring an informed, ethical, and safe line of action, improving data management and information technologies, promoting interoperability and access to accurate and timely data, to strengthen management of information and knowledge, ensuring that decisions on health are based on high-quality data, and to promote innovation in digital health by bringing together emerging technologies such as artificial intelligence and telehealth in order to improve access and efficiency in healthcare services. This plan not only attempts to improve technological capacities and infrastructure, but to establish a sound technological framework that promote safety and ethical use of data, and to ensure that health personnel will have the necessary skills in order to make the best of digital solutions. The implementation of this plan calls for a multi-sectoral effect and the cooperation of different stakeholders, including the private sector, academia, and international organizations. We are committed to providing technical cooperation and continuous follow-up in order to ensure its success. We now invite the committee to carefully review the document, to submit all relevant documents, and to consider the adoption of the proposed resolution, including the annex that proposes to strengthen digital systems and to completely transform our health systems, making them more resilient, equitable, and effective. Thank you.
Muchas gracias.
Thank you. We now call on the Executive Committee to review the information included here, to offer the relevant comments, and to consider the possibility of adopting the proposed resolution presented in Annex A. I will now open the floor to the plenary for discussion on the document presented. Jamaica is recognized.
Thank you, Madam President. Dunstan Bryan, Jamaica. Jamaica welcomes the Plan of Action for Strengthening Information Systems for Health 2024 to 2030 and notes the 4 strategic lines of actions are in alignment with the POA for the period 2019-2023. This will allow for the seamless continuation of the work in progress. With respect to the first strategic line of action, Jamaica is undergoing a digital transformation journey in the health sector. In 2023, the Information Systems for Health Maturity Assessment Tool placed us at level 3 of 5 for the management and governance. Progress has since been made in establishing an expanded framework and organizational structure for the institutionalization of information systems and digital health. We are also working on policy to advance electronic health record, interoperability, identity management, and telehealth, among other works in progress. Assistance will be required from PAO with developing frameworks to support the use of artificial intelligence in health. Concerning strategic line of action 2, Jamaica has established an open data policy with capacity building and the upgrade of the online portal to enable open access to quality data across sectors. We have also developed an architecture for a health information interoperability platform incorporating largely open standards to enable interconnected systems. We are also at the start of our journey with SNOMED CT, becoming the 45th member of SNOMED International and the first Caribbean member of this member state as of January 2023. SNOMED CT, together with Open EHR and HL7 FHIR standards, will enable systematic interoperability between different systems. ICD-11 implementation is likely to be applied to cause of death coding for vital statistics. We recognize the importance of strategic line of action 3. In Jamaica, there is an active initiative to establish a central health data repository that will aggregate data from various sources with an information architecture that enables population health management. Jamaica is keen to learn as well as share knowledge, best practices, and lessons learned through the Latin American and Caribbean Digital Health Network, and welcome collaboration with member states across the region. As it relates to Action 4, the National Roadmap and Strategy for the Digital Transformation of the Health Sector is being refined. More work is, however, needed for telehealth and mobile health initiatives targeting non-communicable disease, in particular with an interoperability by design approach. Jamaica also recognizes, Madam President, the work of your government and extends our gratitude for your willingness to share knowledge, skills, and abilities in our recent study tour to your country in relation to the establishment of an electronic immunization registry in Jamaica. Jamaica supports the Plan of Action for 2024-2030 and anticipates continued technical cooperation to support the strengthening of information system for health agenda. We wish to also register our full endorsement of the proposed resolution for adoption in this council. Thank you.
Muchas gracias, Jamaica.
Thank you very much, Jamaica. Please allow me to thank Jamaica for this recognition for Uruguay. It was a pleasure to have you, and thank you for the cooperation offered by PAHO in order to hold that fruitful exchange for almost a week. Thank you. I now give the floor to Uruguay. Thank you, Madam Chair. We want to offer two comments in connection with the strategic line 1 to strengthen management of information systems. We believe that it is important to say that we've made progress in the interoperability of systems, but we still have to make progress on the use and creation of pathologies records with ethical considerations and necessary security concerns. And in connection with the strategic line 2, we understand that it would be important to develop a cooperation line in order to support countries such as Uruguay in effectively improving and implementing CA11. Thank you. Thank you, Uruguay. I now give the floor to the U.S.
Thank you, Madam President. The United States welcomes the new Plan of Action for Strengthening Information Systems for Health. Global health challenges us to take a hard look at our tools and determine how they can work together to better serve everyone. Incorporating the 4 strategic lines of action improves how we conduct business and communicate with the public. Putting them into practice to create a modern digital strategy prepares us to meet whatever new advances the future brings. The healthcare sector is particularly vulnerable to cybersecurity risks, and the stakes for patient care and safety are particularly high. Healthcare facilities are attractive targets for cyber criminals considering their size, technological dependence, sensitive data, and unique vulnerability to disruptions. Protecting patients' health data also protects the healthcare system. Finally, supporting digital health within healthcare systems fosters data quality because when the people who collect data understand its value and use, its quality and management improve. Also, inefficient health information systems create burdens for healthcare workers and may increase costs. Thank you.
Muchas gracias.
Thank you very much, the U.S., and I now give the floor to Argentina. Thank you, Madam President. Argentina takes note of the document submitted. Argentina welcomes the lessons learned from the pandemic in expediting the development of digital solutions in order to promote progress in information for health systems and in everything that is entailed in digitalization of health data. It is necessary to move forward and make progress on this, and for this to be quick. Digital transformation of the health sector is extremely necessary, particularly in everything that has to do with the data exchange in real time, digital safe solutions, adapted platforms, and interoperable systems. We've recently coincided with other countries in our sub-region in improving collection, analysis, and the use of quality data in order to be able to develop policies and improve health results in our countries. For this, it is no longer necessary to review policies and the regulations that exist today for digital transformation, but to be able to share the experiences on the different initiatives and strategies on the use of technology and artificial intelligence and health available in each country. The ultimate objective is for our countries to be able to define strategies, policies, and standards in order to achieve systems that are interoperable and interconnected, as I said previously, that would lead to better practices in health management so that we can thus make better decisions and to have a well-being within the framework of universal access to health and universal health coverage, health in all policies, electronic government, and the initiative of open data. In this regard, Argentina has been working jointly with other countries in the implementation of the International Patient Summary in order to ensure regional interoperability of data, minimum data of the clinical file, inventories and transformation digital policies in countries in South America, and the submission of experiences on the use of new technologies and intelligence, artificial intelligence within the scope of health. An example of this is an initiative that we've taken with our sister nation of Chile, because we share with Chile one of the vastest borders, not only in the region, but also in the world. And we've developed a system that is cross-border in nature to give a rapid response to the emergency in any one of the points from the north all the way to sinking into the South Sea, and thus to quickly be able, irrespective of where the emergency takes place, to quickly and expeditiously respond to that demand. Currently, we are discussing with the other sister nation of Uruguay to achieve the same situation. Argentina, on the other hand, within the country, has been carrying out, and this is a significant contribution by private entities, a development in artificial intelligence and health in several institutions, which thus enable us to favor a good response to the different problems that health poses. Therefore, we fully support the proposed resolution as it appears in Annex A to support the plan of action to strengthen information systems for health. Thank you.
Muchas gracias, Argentina.
Thank you very much, Argentina. And now I give the floor to Ecuador.
Muchísimas gracias.
Thank you very much, and greeting everyone. I greet my colleagues, you, Director. I appreciate the presentation on the policy. Ecuador is negotiating with CRUSIN, and in the future will be proposing holding some observations having to do with the objectives of 1.1 and 1.2, 1.13 and 2.1.5, 3.1.4 and 4.14. These are minor observations, but they have to do with the indicators directly. We will be sending that to the Secretariat so as to be able to record our observations. Thank you very much. Thank you, Ecuador. I recognize Canada.
Gracias. Realizing as well, thank you, Jamaica, for following instructions, which I have not been doing. Canada, José Roy. Thank you. The COVID-19 pandemic, of course, has brought to the forefront the critical value of data and digital solutions in public health, and we really do applaud PAHO's efforts in providing strategic direction and advancing innovation and effective use of data as a means to improve public health and healthcare as a public good. We are very supportive of the proposed plan of action for strengthening information systems for health, and note that we are very well aligned with the proposed indicators. We particularly appreciate that the document recognizes that interoperability is key for sharing standardized information and facilitating the electronic exchange of data and information to support healthcare delivery and patient care. We also support that the plan of action considers critical aspects of health data and digital transformation, such as the strengthened governance piece, data management, fostering innovation, and including AI. We suggest that the plan of action also consider including data stewardship frameworks and governance models as additional indicators which are emerging as a modernized approach to data management and data governance. This approach is a departure from custodian models of data sharing, which are focused on risk, towards models of stewardship with an increased focus on benefits of sharing. For example, in Canada, federal, provincial, and territorial governments are now collaborating with national health data organizations, including the Canadian Institute for Health Information, on establishing a framework for health data stewardship. So we very much look forward to seeing how this important initiative progresses. Gracias.
Muchas gracias.
Thank you, Canada. I recognize El Salvador. Thank you, Madam Chair, Director. El Salvador has made major strides digitally, aligning our efforts with the objectives of PAHO. In terms of universal connectivity, we have improved our technological infrastructure to close the digital gap. Right now, 100% of health establishments have high-speed internet access and are developing a SIS, which is a single digital system, and all of this is geared towards better patient care so as to provide comprehensive telehealth care. The pandemic brought a crisis, but also an opportunity to digitize health services. We have implemented data governance mechanisms to make certain that all segments of the population will benefit from the progress in digital health. As far as interoperability is concerned, we have improved the infrastructure and have updated our interoperability protocols. We are constantly reviewing efforts, assuring equity in the digital transformation. The country is moving towards an intelligent healthcare service that is data-based. The amount of structured and compiled data makes it possible to see quantitatively how public health is performing. We have comprehensive networks, and that assures the transit of users through the system. Now, there are digital environments for work. We work as a network, and in that way, we can incorporate information from laboratories and medical facilities throughout the country. All of this allows us to visualize implementation of tele-interconsultation and other digital services. Lastly, we wanted to say that we need to make judicious and measured use of artificial intelligence to improve our healthcare service. We have made major improvements, but there are still challenges ahead. We want to improve telehealth to make certain that all citizens will have an access to health in an equitable and effective way. It's important to share best practices so as to accelerate digital health amongst the countries. Our country makes a call to see the digital transformation as groundwork to strengthen health information systems, making it a way to improve the way in which we manage and provide healthcare. Thank you. Thank you, El Salvador. I recognize Brazil. Thank you very much, Madam Chair.
Renew this plan of action, take into account the high level of interest it has created. As the presenter has pointed out, in 4 years, out of 22 indicators, 13 have been exceeded and 2 have been fully achieved. Yet 42% of countries are still in level 1 and 0% have reached the level 5. So this proposal is a comprehensive plan for the digital transformation of the health sector, which aims to ensure quality, reliability, security, availability, and governance of data. We are aware that there are challenges such as technological and financial aspects and profound regional inequalities. The legal aspect also brings complexities, such as the regulation of artificial intelligence and ensuring digital literacy for the population, healthcare professionals, and policymakers. In this regard, we would like to stress the need for policies that guarantee that gains from digital transformation in health will be distributed and accessed by all people, especially by vulnerable groups. Taking into account the social and digital determinants of health, Brazil believes that the expansion of technologies such as telehealth and AI can provide equitable access to healthcare, especially in remote areas. In this sense, we suggest that the principle of equity should be considered in some indicator of the plan of action. In the sense of continuing to contribute with the plan, it's important to us to see reflected in the text some indicators that could be considered, such as the proportion of interoperable electronic health records at different levels of healthcare in our region, the proportion of digital health platform users, implemented artificial intelligence solutions, and efforts to assess the quality and integrity of collected data in our region. Thank you.
Muchas gracias, Brasil.
Thank you, Brazil. I recognize Garcia Saiso, Dr. Garcia Saiso. Thank you. I thank Jamaica, Uruguay, United States, Ecuador, Canada, El Salvador, and Brazil for their comments. Right from the start of this initiative to strengthen information systems for health, I as for H, Jamaica has been a key actor. It was in Jamaica that we had the first sub-regional meeting for the Caribbean, and that gave rise to this approach to strengthen information systems as a priority area. The efforts that have been made, and we just heard examples from all the countries of the region, contribute to the major progress made by the Action Plan 2019-2023. Now, there still are major challenges, that's been pointed out. It's important to step up our pace. That is essential. To strengthen our health systems, we need resilient systems required by the current and future challenges in health. We need to have information systems that would provide us data within the format and on a timely basis so as to have at hand the evidence needed. We have to work at the local level with primary health care. There is still a major lack of interoperability, and there we have digital and analog-based, paper-based systems working side by side, and a lot of the information in our systems is no longer available to guide action. We need to focus our efforts so that digital transformation will be a mechanism that will help close the equity gaps that persist in the region, and in that way we will be able to obtain better and more robust health results in the population. We take note of the progress made, and of course we are ready to provide technical cooperation and support in the future. we will look at the changes being presented by Ecuador. I understand that Ecuador sent those proposed changes to the Secretariat. Thank you very much, Dr. Garcia Sarizón. I wanted to ask the Director, do you have any comments? Yes. Thank you very much, Madam Chair. First of all, I would like to recognize the major accomplishments in this area in recent years. I think that this is a strong commitment on the part of the countries of the Americas. And also, it is time to recognize the important support that we receive, first of all, from the partnership that we have with the Inter-American Development Bank. Thanks to that partnership, the countries have mobilized more than $900 million in loans made available by the bank to invest in strengthening information systems and in assuring digital healthcare transformation. That is one of the priorities in the Memorandum of Understanding that I signed a few months ago with the President of the IDB. Also, I wanted to recognize the support received from some donors. The United States, for example, through USAID and CDC, from Spain, and also from Canada. All of this has been significant support for countries, enabling them to strengthen their health information systems, the quality of data, get data broken down. In other words, all of the changes we need so as to assure effective data use and to be able to use the information produced so as to better identify the gaps and the most vulnerable populations and adopt important strategies to overcome the barriers to access that exist in many countries and in many regions. An important example, and I thank Jamaica for highlighting this, has to do with transformation so that we will have electronic records in the region for immunization. Despite all of the progress, for some reason, still, most of the countries in the region do not have individual information on people that have been vaccinated. We have a record of the doses given, but in many countries it is impossible to identify exactly who was vaccinated and who was not. And that makes it hard to identify or to determine where we have unvaccinated populations. And that would help us identify the barriers standing in the way of establishing a strategy. So we are calling on the countries of the region, asking them to build on the platforms that were developed by everyone during the COVID-19 pandemic so as to have an electronic record of the vaccination given during COVID-19. That should be used for polio, for smallpox, et cetera, Without that, and here I'm underscoring the importance of this issue, because without that, we cannot identify where the vaccinated population is. And we continue to implement the same strategies that are leaving whole groups of the population behind. Now, just many countries, and that was brought up by Canada and others, you referred to interoperability. And there we have to make certain that this be an effort made in the framework of the transformations being implemented by all governments. It's important that we look at e-governance systems so that we can have systems that can share and interact with other systems so that countries can make the most rational use possible of the investments being made in this area to improve the quality of data, the quality of care, the healthcare services, but also making it possible to make use of telemedicine, telehealth, tools of this nature to improve the quality of primary health care and improve access and quality of healthcare services in the populations living in remote areas. So this new action plan underpins the efforts and also highlights the accomplishments of countries. Over the next years, I hope we can make even further progress and that the member countries will have information systems that will support the quality of healthcare delivery in the region. Thank you. Thank you very much, Mr. President. I would ask the rapporteur to read the proposed resolution. Thank you, Madam Chair. Proposed resolution, plan of action for strengthening information systems for health for 2024-2030. The 174th session of the Executive Committee, preambular paragraph, having reviewed the proposed plan of action for strengthening information systems for health 2024-2030, document CE 174/15, resolves, operative paragraph, to recommend that the 61st Directing Council adopt a resolution in the following terms. Plan of action for strengthening information systems for health 2024-2030. The 61st Directing Council, preambular paragraph 1, having reviewed the plan of action for strengthening information systems for health 2024-2030, preambular paragraph 2, recognizing the urgent need to continue strengthening information systems for health and to advance the digital transformation of the health sector as key elements of support for universal, equitable, and resilient health systems. PP3, considering that action by member states is required to strengthen leadership, stewardship, and governance through a renewed emphasis on digital transformation. PP4, noting that institutional capacities to enable the implementation of interoperable information systems for health must be strengthened, given that these systems are a central component of the primary health care approach. Resolves. Operative paragraph 1. To approve the plan of action for strengthening information systems for health 2024-2030, OP2. To urge all member states, considering their context, needs, vulnerabilities, and priorities, to A, promote the implementation of the lines of action contained in the plan of action for strengthening information systems for health 2024-2030. B, strengthen the management and governance of information systems for health within the framework of the digital transformation of government initiatives. C, build the necessary infrastructure for supporting the implementation of national and subnational information systems for health and data management frameworks. D, establish regulatory frameworks for enhancing the management of health-related data, platforms, and digital health solutions. E, ensure that human resources have the necessary competencies to effectively implement digital health solutions at all levels of care. Operative paragraph 3, to request the director to A, provide technical cooperation to member states to strengthen capacities that contribute to the implementation of the plan of action and the achievement of its objectives. B, report periodically to the governing bodies of PAHO on the progress made and challenges faced in the implementation of the plan of action through a midterm review in 2027 and a final report in 2031. Thank you very much, Madam Chair. Thank you. I now open the floor to the plenary for discussion.
De no haber objeciones.
If there are no objections, I declare the resolution adopted.
hemos sido muy eficientes.
We have been quite efficient this morning, so we're going to take a brief and come back at 2 p.m. But before that, I want to tell you that this afternoon, we are going to be working on 4.5, which is policy on long-term care. Also 4.6, a strategy for strengthening the essential public health functions to accelerate health systems transformation 2024-2034. And that is CE 174/17. And then we will go to 4.7, which is a strategy and plan of action to strengthen tobacco control in the region of the Americas 2025. That is CE 174/18. And if we have enough time, we will also be looking at 4.8, strategy on integrated emergency, critical, and operative care 2025-2030. That is document CE 174/19. So I recognize Dr. Valdez for some announcements.
We now invite our delegates to join us in Room A, which is on this floor, for the commemorative photo. And then immediately following the photo, we please ask that the members of the Committee of the PAHO Award for Health Services Management and Leadership 2024 please meet in Room C. Members of this committee are Guyana, the United States of America, and Uruguay. A light lunch will be served and interpretation will be provided for this meeting. Thank you, Madam Chair.
Muchas gracias.
Thank you very much. With that, we concluded the morning's work and we will come back at 2 p.m. Enjoy your lunch.
Vamos a la foto ahora.
But first, we all go to the photo.
AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Over the past year, PAHO has made significant strides in fostering an evaluation culture and practice to increase effectiveness, efficiency, transparency, and accountability of its work. See some of the main goals PAHO has reached so far. 5 major evaluations conducted and ongoing. 3 of them are published, including the evaluation of PAHO's response to COVID-19. The first evaluation of the kind among all WHO regions, creation of a repository gathering all evaluation evidence in PAHO for enhanced institutional memory and learning, personnel capacity building in evaluation practices, launch of PAHO's evaluation external website for increased transparency and accountability, more than 30 recommendations from evaluations being implemented and tracked through the new evaluation platform. How has your work been informed by evaluation? Join us on this journey of continuous improvement as PAHO works to evolve and achieve better results through evaluation and learning.
Buenas. Hola Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está? Pues todo bien. En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica sectorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ya se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo, otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se les solicita a la voluntaria de salud y a la
paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo. Les damos charlas a las madres, como identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño, que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria.
9 meses del embarazo, desde allí estoy yo pendiente. Estoy con el celular, me llaman. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora, 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso y apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos tamizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto pues, fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándole capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. Presupuesto que nos permita adaptar y continuar algunas de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Estamos en Puerto Inírida, Guainía, la triple frontera con Venezuela y Brasil, para el lanzamiento de la Semana de la Vacunación de las Américas. Buscamos reforzar la importancia de las vacunas. Las vacunas son seguras, eficientes y nos ayudan a prevenir enfermedades, así como también a salvar vidas.
Dándoles pues la bienvenida, dándole la bendición, que eso es lo que siempre hemos soñado en nuestro departamento, que llegue la salud a territorio.
La Organización Panamericana de la Salud, que está conformada por todos los países de la región de las Américas, hace un esfuerzo único para poder incrementar las coberturas de vacunación. Desde su secretariado, la Oficina Sanitaria Panamericana, trabajamos mano a mano con cada uno de los territorios, en este caso en Colombia, para poder llegar a los municipios más alejados, llegar a esas comunidades indígenas, a las poblaciones afrodescendentes, a las diferentes etnias, llevando las vacunas y también otros servicios para proteger la salud y el bienestar de los pobladores.
Y gran parte de nuestra población se encuentra ubicada en zona rural y rural dispersa. Entonces, el acceso ya se ha convertido en una de las cosas más importantes para el programa, y es, así como los niños de las ciudades reciben la vacuna, poder llegar a esos niños tan alejados y que están en una situación, hay veces de vulnerabilidad, en donde hay mayor riesgo de enfermar, ya sea porque no se tienen una mala nutrición. Entonces las vacunas ayudan a ese sistema inmunológico para que se desarrolle y no se enferme, porque la probabilidad de que pueda morir, por ejemplo, por un sarampión y además de una persona desnutrida, aumenta la probabilidad. Entonces, vacunar a esa población susceptible y que está alejada y muy vulnerable, es de vital importancia para nosotros en esta jornada de Semana de Vacunación en las Américas. Hacemos un mayor énfasis en estos territorios vulnerables para que podamos de alguna manera utilizar estrategias para poder llegar a esta población que está más alejada y, como mencionaba, que vive en zona fronteriza y que vive en zona rural dispersa. Entonces, muchas veces lo que hacen las entidades territoriales y las secretarías de salud y las IPS que realizan estas actividades es realizar recorridos por las comunidades que viven cercanas a los ríos y que además están en frontera. Entonces nosotros debemos hacerles saber a la población que ellos son beneficiados por esto, que deben pedir y deben luchar por ese derecho que tienen hacia vacunar. Es un derecho que tienen los niños y deben exigirlo, deben exigir la vacunación.
Y por eso hay que comenzar desde la base. Estos equipos tienen que ir a atender las necesidades de cada una de las comunidades.
Algunas comunidades, algunas etnias pues no entienden pues lo que son las vacunas, pero ahí vamos paso a paso y pues que dejen de vacunar a los niños para que en el futuro pues no les den las enfermedades por las cuales pues estamos vacunando.
La jornada para nosotros ha sido productiva. Hemos encontrado algunos niños para vacunación. Hemos realizado la respectiva vacunación y además sí se presta para seguir administrando las próximas dosis.
Reafirmar que las vacunas son seguras, las vacunas son eficaces, nos permiten prevenir enfermedades y salvar vidas y las vacunas son gratuitas. Colombia ha hecho una gran inversión en el programa ampliado de inmunizaciones, tiene 21 vacunas para 26 enfermedades y son gratuitas para todos los proveedores en el territorio. En Colombia no hay barreras para la vacunación. Lleven la voz, hagan que cada miembro de su comunidad esté vacunado, protegido contra las enfermedades. Muchas gracias.
Para nosotros, la captura de pequeños mamíferos es importante para identificar diferentes patógenos. En algunas ocasiones colocamos redes para capturar murciélagos, extraemos muestras de sangre, muestras de tejido para llevarlas al laboratorio y luego entonces identificar estos pequeños mamíferos y sus patógenos que nos pueden causar algún problema de salud. El mayor problema en los murciélagos sería la rabia, que es una enfermedad que no es muy estudiada en diferentes lugares. Si hay un caso de alguna persona infectada por Hanca, tenemos que buscar entonces los sitios adecuados para poder colocar las trampas, y principalmente la vivienda de la persona, los sitios donde habitualmente circula la persona, si es un área de cultivo, si es el patio de la casa, para aumentar el interés de poder capturar los animales que queremos.
La OPS está desarrollando una iniciativa en conjunto con el CDC, con el Instituto Nacional de Enfermedades Virales Hemorrágicas y el Instituto Gorgas, para diseñar un taller que permita hacer la transferencia en el manejo de potenciales enfermedades zoonóticas que algunas conocemos, otras son desconocidas, como por ejemplo hantavirus y adenavirus, que ha afectado en diferentes regiones de las Américas, como Bolivia, como Argentina, Venezuela, en relación a adenavirus o hantavirus en Brasil, Argentina, Chile, Uruguay, Paraguay, Panamá, Bolivia. Pero hay otros países y desconocemos esa situación. La pandemia nos ha enseñado que no podemos quedarnos con los brazos cruzados, que debemos estar preparados, y la Organización Mundial de la Salud, la Organización Panamericana de la Salud, tuvo una vital participación y protagonismo en recordarnos de que tenemos que trabajar unidos.
Somos 3 centros colaboradores más los expertos de OPS, todos al mismo tiempo trabajando con el objetivo de diseñar un taller que sea bastante realista, que vaya a tener escenarios. Es un ejercicio tipo tabletop exercise en donde realmente los escenarios se basan en lo que hemos hecho en el pasado, lo que nos ha tocado vivir, tanto en la parte de epidemiología como en laboratorio, como de ecología. Y eso es una gran fortaleza que se tiene, que seamos diferentes centros con diferentes capacidades, con diferentes retos, pero que todos nos estamos poniendo de acuerdo para diseñar algo que va a servir a países que ya tienen vigilancia y países que no tienen vigilancia. Eso por un lado. Y justamente los retos es que no todos los países son iguales. Uno de los grandes retos es que hay algunos países que ya tienen vigilancia, diagnóstico, cosas establecidas, y hay países que realmente no es que estén empezando de cero, pero digamos que no hay una vigilancia ni de hantavirus ni de adenavirus que esté establecida. Entonces tenemos que hacer algo que funcione un poco para todos. Por eso la idea de tener estos ejercicios con escenarios y con diferentes situaciones que se puedan analizar conjuntamente. El otro reto que se mantiene obviamente es darle sostenibilidad a este tipo de iniciativa, porque nosotros pues hasta la fecha hemos funcionado a través de un acuerdo cooperativo que tenemos con la OPS, y bueno, mientras teníamos la posibilidad de apoyar ese acuerdo cooperativo lo hacemos, pero en realidad ese apoyo es muy pequeño y realmente se necesita más recursos para poder realmente montar este proyecto y desarrollarlo y continuarlo y darle sostenibilidad, porque no vale la pena mandar los ensayos, los primers, las sondas y algunos reactivos a un país y luego ya no lo pueden hacer porque ya no tienen kit. Entonces ese es uno de los retos.
Presentamos la Reserva Estratégica para Emergencias y Desastres en Salud de la Organización Panamericana de la Salud Jerónimo Venegas, ubicada en el Depósito de Respuesta Humanitaria de las Naciones Unidas en el Centro Logístico Regional en Panamá. La reserva se ha establecido como parte de un mecanismo operacional regional que apoya a países en situaciones de emergencia mediante el envío de suministros cuando es necesario, dando una respuesta rápida, coordinada y eficaz. Esto se logra gracias a la coordinación entre diferentes equipos, la evaluación de necesidades, la integración de sistemas logísticos y la vinculación de procesos administrativos especiales de emergencia. La gestión técnica y operativa de la Reserva está a cargo del Departamento de Emergencias en Salud de la Organización Panamericana de la Salud, en estrecha coordinación con áreas técnicas y entidades de apoyo a nivel regional. Los beneficios de este mecanismo incluyen la reducción de los tiempos de entrega, la disminución de los riesgos de retrasos, el almacenamiento seguro, el cumplimiento de los estándares de calidad y una visión integral de la prestación de servicios de salud. La Reserva ha brindado apoyo en situaciones de inundaciones, terremotos, erupciones volcánicas, tormentas tropicales, huracanes, brotes de enfermedades y emergencias prolongadas en la región. Además, se cuenta con un inventario identificado y actualizado mediante análisis técnico, basado en lecciones aprendidas y la experiencia en eventos previos. Con esto, la Reserva Estratégica para Emergencias y Desastres en Salud Jerónimo Venegas muestra que ante situaciones de emergencia en nuestra región es un mecanismo fundamental de apoyo a los países afectados para proteger a los más vulnerables y salvar vidas.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Over the past year, PAHO has made significant strides in fostering an evaluation culture and practice to increase effectiveness, efficiency, transparency, and accountability of its work. See some of the main goals PAHO has reached so far. 5 major evaluations conducted and ongoing. 3 of them are published, including the evaluation of PAHO's response to COVID-19. The first evaluation of the kind among all WHO regions, creation of a repository gathering all evaluation evidence in PAHO for enhanced institutional memory and learning, personnel capacity building in evaluation practices, launch of PAHO's evaluation external website for increased transparency and accountability, more than 30 recommendations from evaluations being implemented and tracked through the new evaluation platform. How has your work been informed by evaluation? Join us on this journey of continuous improvement as PAHO works to evolve and achieve better results through evaluation and learning.
Buenas.
Hola Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está? ¿Pues todo bien?
En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica asistorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ya se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo, otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se les solicita a la voluntaria de salud y a la
paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo. Les damos charlas a las madres, como identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño, que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria.
9 meses del embarazo, desde allí estoy yo pendiente. Estoy con el celular, me llamo. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora, 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso y apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos amizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto pues, fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándole capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. Presupuesto que nos permita adaptar y continuar algunas de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Estamos en Puerto Inírida, Guainía, la triple frontera con Venezuela y Brasil, para el lanzamiento de la Semana de la Vacunación de las Américas. Buscamos reforzar la importancia de las vacunas. Las vacunas son seguras, eficientes y nos ayudan a prevenir enfermedades, así como también a salvar vidas.
Dándoles pues la bienvenida, dándole la bendición, que eso es lo que siempre hemos soñado en nuestro departamento, que llegue la salud a territorio.
La Organización Panamericana de la Salud, que está conformada por todos los países de la región de las Américas, hace un esfuerzo único para poder incrementar las coberturas de vacunación. Desde su secretariado, la Oficina Sanitaria Panamericana, trabajamos mano a mano con cada uno de los territorios, en este caso en Colombia, para poder llegar a los municipios más alejados, llegar a esas comunidades indígenas, a las poblaciones afrodescendentes, a las diferentes etnias, llevando las vacunas y también otros servicios para proteger la salud y el bienestar de los pobladores.
Y gran parte de nuestra población se encuentra ubicada en zona rural y rural dispersa. Entonces, el acceso ya se ha convertido en una de las cosas más importantes para el programa, y es, así como los niños de las ciudades reciben la vacuna, poder llegar a esos niños tan alejados y que están en una situación, hay veces de vulnerabilidad, en donde hay mayor riesgo de enfermar, ya sea porque no se tienen una muy mala nutrición. Entonces las vacunas ayudan a ese sistema inmunológico para que se desarrolle y no se enferme, porque la probabilidad de que pueda morir, por ejemplo, por un sarampión y además de una persona desnutrida aumenta la probabilidad. Entonces, vacunar a esa población susceptible y que está alejada y muy vulnerable, es de vital importancia para nosotros en esta jornada de Semana de Vacunación en las Américas. Hacemos un mayor énfasis en estos territorios vulnerables para que podamos de alguna manera utilizar estrategias para poder llegar a esta población que está más alejada y, como mencionaba, que vive en zona fronteriza y que vive en zona rural dispersa. Entonces, muchas veces lo que hacen las entidades territoriales y las secretarías de salud y las IPS que realizan estas actividades es realizar recorridos por las comunidades que viven cercanas a los ríos y que además están en frontera. Entonces nosotros debemos hacerles saber a la población que ellos son beneficiados por esto, que deben pedir y deben luchar por ese derecho que tienen hacia vacunar. Es un derecho que tienen los niños y deben exigirlo, deben exigir la vacunación.
Y por eso hay que comenzar desde la base. Estos equipos tienen que ir a atender las necesidades de cada una de las comunidades.
Algunas comunidades, algunas etnias pues no entienden pues lo que son las vacunas, pero ahí vamos paso a paso y pues que dejen de vacunar a los niños para que en el futuro pues no les den las enfermedades por las cuales pues estamos vacunando.
La jornada para nosotros ha sido productiva. Hemos encontrado algunos niños para vacunación, hemos realizado la respectiva vacunación y además sí se presta para seguir administrando las próximas dosis.
Reafirmar que las vacunas son seguras, las vacunas son eficaces, nos permiten prevenir enfermedades y salvar vidas, y las vacunas son gratuitas. Colombia ha hecho una gran inversión en el programa ampliado de inmunizaciones, tiene 21 vacunas para 26 enfermedades y son gratuitas para todos los proveedores en el territorio. En Colombia no hay barreras para la vacunación. Lleven la voz, hagan que cada miembro de su comunidad esté vacunado, protegido contra las enfermedades. Muchas gracias.
Para nosotros, la captura de pequeños mamíferos es importante para identificar diferentes patógenos. En algunas ocasiones colocamos redes para capturar murciélagos, extraemos muestras de sangre, muestras de tejido para llevarlas al laboratorio y luego entonces identificar estos pequeños mamíferos y sus patógenos que nos pueden causar algún problema de salud. El mayor problema en los murciélagos sería la rabia, que es una enfermedad que no es muy estudiada en diferentes lugares. Si hay un caso de alguna persona infectada por Hanca, tenemos que buscar entonces los sitios adecuados para poder colocar las trampas, y principalmente la vivienda de la persona, los sitios donde habitualmente circula la persona, si es un área de cultivo, si es el patio de la casa, para aumentar el interés de poder capturar los animales que queremos.
La OPS está desarrollando una iniciativa en conjunto con el CDC, con el Instituto Nacional de Enfermedades Virales Hemorrágicas y el Instituto Gorgas, para diseñar un taller que permita hacer la transferencia en el manejo de potenciales enfermedades zoonóticas que algunas conocemos, otras son desconocidas, como por ejemplo hantavirus y adenovirus, que ha afectado en diferentes regiones de las Américas, como Bolivia, como Argentina, Venezuela, en relación a arenavirus o hantavirus en Brasil, Argentina, Chile, Uruguay, Paraguay, Panamá, Bolivia. Pero hay otros países que desconocemos esa situación. La pandemia nos ha enseñado que no podemos quedarnos con los brazos cruzados, que debemos de estar preparados, y la Organización Mundial de la Salud, la Organización Panamericana de la Salud, tuvo una vital participación y protagonismo en recordarnos de que tenemos que trabajar unidos.
Somos 3 centros colaboradores más los expertos de OPS, todos al mismo tiempo trabajando con el objetivo de diseñar un taller que sea bastante realista, que vaya a tener escenarios. Es un ejercicio tipo tabletop exercise en donde realmente los escenarios se basan en lo que hemos hecho en el pasado, lo que nos ha tocado vivir, tanto en la parte de epidemiología como en laboratorio, como de ecología. Y eso es una gran fortaleza que se tiene, que seamos diferentes centros con diferentes capacidades, con diferentes retos, pero que todos nos estamos poniendo de acuerdo para diseñar algo que va a servir a países que ya tienen vigilancia y países que no tienen vigilancia. Eso por un lado. Y justamente los retos es que no todos los países son iguales. Uno de los grandes retos es que hay algunos países que ya tienen vigilancia, diagnóstico, cosas establecidas, y hay países que realmente no es que estén empezando de cero, pero digamos que no hay una vigilancia que funcione un poco para todos. Por eso la idea de tener estos ejercicios con escenarios y con diferentes situaciones que se puedan analizar conjuntamente. El otro reto que se mantiene obviamente es darle sostenibilidad a este tipo de iniciativa, porque nosotros pues hasta la fecha hemos funcionado a través de un acuerdo cooperativo que tenemos con la OPS, y bueno, mientras teníamos la posibilidad de apoyar ese acuerdo cooperativo lo hacemos, pero en realidad ese apoyo es muy pequeño y realmente se necesita más recursos para poder realmente montar este proyecto y desarrollarlo y continuarlo y darle sostenibilidad, porque no vale la pena mandar los ensayos, los primers, las sondas y algunos reactivos a un país y luego ya no lo pueden hacer porque ya no tienen kit. Entonces ese es uno de los retos.
Presentamos la Reserva Estratégica para Emergencias y Desastres en Salud de la Organización Panamericana de la Salud Jerónimo Venegas, ubicada en el Depósito de Respuesta Humanitaria de las Naciones Unidas en el Centro Logístico Regional en Panamá. La reserva se ha establecido como parte de un mecanismo operacional regional que apoya a países en situaciones de emergencia mediante el envío de suministros cuando es necesario, dando una respuesta rápida, coordinada y eficaz. Esto se logra gracias a la coordinación entre diferentes equipos, la evaluación de necesidades, la integración de sistemas logísticos y la vinculación de procesos administrativos especiales de emergencia. La gestión técnica y operativa de la Reserva está a cargo del Departamento de Emergencias en Salud de la Organización Panamericana de la Salud, en estrecha coordinación con áreas técnicas y entidades de apoyo a nivel regional. Los beneficios de este mecanismo incluyen la reducción de los tiempos de entrega, la disminución de los riesgos de retrasos, el almacenamiento seguro, el cumplimiento de los estándares de calidad y una visión integral de la prestación de servicios de salud. La Reserva ha brindado apoyo en situaciones de inundaciones, terremotos, erupciones volcánicas, tormentas tropicales, huracanes, brotes de enfermedades y emergencias prolongadas en la región. Además, se cuenta con un inventario identificado y actualizado mediante análisis técnico, basado en lecciones aprendidas y la experiencia en eventos previos. Con esto, la Reserva Estratégica para Emergencias y Desastres en Salud Jerónimo Venegas muestra que ante situaciones de emergencia en nuestra región es un mecanismo fundamental de apoyo a los países afectados para proteger a los más vulnerables y salvar vidas.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's right to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Over the past year, PAHO has made significant strides in fostering an evaluation culture and practice to increase effectiveness, efficiency, transparency, and accountability of its work. See some of the main goals PAHO has reached so far. 5 major evaluations conducted and ongoing. 3 of them are published, including the evaluation of PAHO's response to COVID-19. The first evaluation of the kind among all WHO regions, creation of a repository gathering all evaluation evidence in PAHO for enhanced institutional memory and learning, personnel capacity building in evaluation practices, launch of PAHO's evaluation external website for increased transparency and accountability, more than 30 recommendations from evaluations being implemented and tracked through the new evaluation platform. How has your work been informed by evaluation? Join us on this journey of continuous improvement as PAHO works to evolve and achieve better results through evaluation and learning.
Buenas. Hola Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está? Pues todo bien. En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica asistorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ellas se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se les solicita a la voluntaria de salud y a la
paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo. Les damos charlas a las madres, como cuando identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria.
9 meses del embarazo, desde allí estoy yo pendiente. Estoy con el celular, me llamo. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora, 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso de apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos amizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto pues, fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándole capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. Presupuesto que nos permita adaptar y continuar algunas de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Estamos en Puerto Inírida, Guainía, la triple frontera con Venezuela y Brasil, para el lanzamiento de la Semana de la Vacunación de las Américas. Buscamos reforzar la importancia de las vacunas. Las vacunas son seguras, eficientes y nos ayudan a prevenir enfermedades, así como también a salvar vidas.
Dándoles pues la bienvenida, dándole la bendición, que eso es lo que siempre hemos soñado en nuestro departamento, que llegue la salud a territorio.
La Organización Panamericana de la Salud, que está conformada por todos los países de la región de las Américas, hace un esfuerzo único para poder incrementar las coberturas de vacunación. Desde su secretariado, la Oficina Sanitaria Panamericana, trabajamos mano a mano con cada uno de los territorios, en este caso en Colombia, para poder llegar a los municipios más alejados, llegar a esas comunidades indígenas, a las poblaciones afrodescendentes, a las diferentes etnias, llevando las vacunas y también otros servicios para proteger la salud y el bienestar de los pobladores.
Y gran parte de nuestra población se encuentra ubicada en zona rural y rural dispersa. Entonces, el acceso ya se ha convertido en una de las cosas más importantes para el programa, y es, así como los niños de las ciudades reciben la vacuna, poder llegar a esos niños tan alejados y que están en una situación, hay veces de vulnerabilidad, en donde hay mayor riesgo de enfermar, ya sea porque no se tienen una mala nutrición. Entonces las vacunas ayudan a ese sistema inmunológico para que se desarrolle y no se enferme, porque la probabilidad de que pueda morir, por ejemplo, por un sarampión y además de una persona desnutrida, aumenta la probabilidad. Entonces, el vacunar a esa población susceptible y que está alejada y muy vulnerable es de vital importancia para nosotros en esta jornada de Semana de Vacunación en las Américas. Hacemos un mayor énfasis en estos territorios vulnerables para que podamos de alguna manera utilizar estrategias para poder llegar a esta población que está más alejada y, como mencionaba, que vive en zona fronteriza y que vive en zona rural dispersa. Entonces, muchas veces lo que hacen las entidades territoriales y las secretarías de salud y las IPS que realizan estas actividades es realizar recorridos por las comunidades que viven cercanas a los ríos y que además están en frontera. Entonces nosotros debemos hacerles saber a la población que ellos son beneficiados por esto, que deben pedir y deben luchar por ese derecho que tienen hacia vacunar. Es un derecho que tienen los niños y deben exigirlo, deben exigir la vacunación.
Y por eso hay que comenzar desde la base. Estos equipos tienen que ir a atender las necesidades de cada una de las comunidades.
Algunas comunidades, algunas etnias pues no entienden pues lo que son las vacunas, pero ahí vamos paso a paso y pues que dejen de vacunar a los niños para que en el futuro pues no les den las enfermedades por las cuales pues estamos vacunando.
La jornada para nosotros ha sido productiva. Hemos encontrado algunos niños para vacunación. Hemos realizado la respectiva vacunación y además sí se presta para seguir administrando las próximas dosis.
Reafirmar que las vacunas son seguras, las vacunas son eficaces, nos permiten prevenir enfermedades y salvar vidas y las vacunas son gratuitas. Colombia ha hecho una gran inversión en el programa ampliado de inmunizaciones, tiene 21 vacunas para 26 enfermedades y son gratuitas para todos los proveedores en el territorio. En Colombia no hay barreras para la vacunación. Lleven la voz, hagan que cada miembro de su comunidad esté vacunado, protegido contra las enfermedades. Muchas gracias.
Para nosotros, la captura de pequeños mamíferos es importante para identificar diferentes patógenos. En algunas ocasiones colocamos redes para capturar murciélagos, extraemos muestras de sangre, muestras de tejido para llevarlas al laboratorio y luego entonces identificar estos pequeños mamíferos de sus patógenos que nos pueden causar algún problema de salud. El mayor problema en los murciélagos sería la rabia, que es una enfermedad que no es muy estudiada en diferentes lugares. Si hay un caso de alguna persona infectada por Hanca, tenemos que buscar entonces los sitios adecuados para poder colocar las trampas, y principalmente la vivienda de la persona, los sitios donde habitualmente circula la persona, si es un área de cultivo, si es el patio de la casa, para aumentar el interés de poder capturar los animales que queremos.
La OPS está desarrollando una iniciativa en conjunto con el CDC, con el Instituto Nacional de Enfermedades Virales Hemorrágicas y el Instituto Gorgas, para diseñar un taller que permita hacer la transferencia en el manejo de potenciales enfermedades zoonóticas que algunas conocemos, otras son desconocidas, como por ejemplo hantavirus y adenavirus, que ha afectado en diferentes regiones de las Américas, como Bolivia, como Argentina, Venezuela, en relación a adenavirus o hantavirus en Brasil, Argentina, Chile, Uruguay, Paraguay, Panamá, Bolivia. Pero hay otros países y desconocemos esa situación. La pandemia nos ha enseñado que no podemos quedarnos con los brazos cruzados, que debemos estar preparados, y la Organización Mundial de la Salud, la Organización Panamericana de la Salud, tuvo una vital participación y protagonismo en recordarnos de que tenemos que trabajar unidos.
Somos 3 centros colaboradores más los expertos de OPS, todos al mismo tiempo trabajando con el objetivo de diseñar un taller que sea bastante realista, que vaya a tener escenarios. Es un ejercicio tipo tabletop exercise en donde realmente los escenarios se basan en lo que hemos hecho en el pasado, lo que nos ha tocado vivir, tanto en la parte de epidemiología como en laboratorio, como de ecología. Y eso es una gran fortaleza que se tiene, que seamos diferentes centros con diferentes capacidades, con diferentes retos, pero que todos nos estamos poniendo de acuerdo para diseñar algo que va a servir a países que ya tienen vigilancia y países que no tienen vigilancia. Eso por un lado. Y justamente los retos es que no todos los países son iguales. Uno de los grandes retos es que hay algunos países que ya tienen vigilancia, diagnóstico, cosas establecidas, y hay países que realmente no es que estén empezando de cero, pero digamos que no hay una vigilancia ni de hantavirus ni de adenavirus que esté establecida. Entonces tenemos que hacer algo que funcione un poco para todos. Por eso la idea de tener estos ejercicios con escenarios y con diferentes situaciones que se puedan analizar conjuntamente. El otro reto que se mantiene obviamente es darle sostenibilidad a este tipo de iniciativa, porque nosotros pues hasta la fecha hemos funcionado a través de un acuerdo cooperativo que tenemos con la OPS, y bueno, mientras teníamos la posibilidad de apoyar ese acuerdo cooperativo lo hacemos, pero en realidad ese apoyo es muy pequeño y realmente se necesita más recursos para poder realmente montar este proyecto y desarrollarlo y continuarlo y darle sostenibilidad, porque no vale la pena mandar los ensayos, los primers, las sondas y algunos reactivos a un país y luego ya no lo pueden hacer porque ya no tienen kit. Entonces ese es uno de los retos.
Presentamos la Reserva Estratégica para Emergencias y Desastres en Salud de la Organización Panamericana de la Salud Jerónimo Venegas, ubicada en el Depósito de Respuesta Humanitaria de las Naciones Unidas en el Centro Logístico Regional en Panamá. La reserva se ha establecido como parte de un mecanismo operacional regional que apoya a países en situaciones de emergencia mediante el envío de suministros cuando es necesario, dando una respuesta rápida, coordinada y eficaz. Esto se logra gracias a la coordinación entre diferentes equipos, la evaluación de necesidades, la integración de sistemas logísticos y la vinculación de procesos administrativos especiales de emergencia. La gestión técnica y operativa de la Reserva está a cargo del Departamento de Emergencias en Salud de la Organización Panamericana de la Salud, en estrecha coordinación con áreas técnicas y entidades de apoyo a nivel regional. Los beneficios de este mecanismo incluyen la reducción de los tiempos de entrega, la disminución de los riesgos de retrasos, el almacenamiento seguro, el cumplimiento de los estándares de calidad y una visión integral de la prestación de servicios de salud. La Reserva ha brindado apoyo en situaciones de inundaciones, terremotos, erupciones volcánicas, tormentas tropicales, huracanes, brotes de enfermedades y emergencias prolongadas en la región. Además, se cuenta con un inventario identificado y actualizado mediante análisis técnico, basado en lecciones aprendidas y la experiencia en eventos previos. Con esto, la Reserva Estratégica para Emergencias y Desastres en Salud Jerónimo Venegas muestra que ante situaciones de emergencia en nuestra región es un mecanismo fundamental de apoyo a los países afectados para proteger a los más vulnerables y salvar vidas.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving. Yes. Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Over the past year, PAHO has made significant strides in fostering an evaluation culture and practice to increase effectiveness, efficiency, transparency, and accountability of its work. See some of the main goals PAHO has reached so far. 5 major evaluations conducted and ongoing. 3 of them are published, including the evaluation of PAHO's response to COVID-19. The first evaluation of the kind among all WHO regions, creation of a repository gathering all evaluation evidence in PAHO for enhanced institutional memory and learning, personnel capacity building in evaluation practices, launch of PAHO's evaluation external website for increased transparency and accountability, more than 30 recommendations from evaluations being implemented and tracked through the new evaluation platform. How has your work been informed by evaluation? Join us on this journey of continuous improvement as PAHO works to evolve and achieve better results through evaluation and learning.
Buenas. Hola Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está? Pues todo bien.
En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica asistorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ya se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se les solicita a la voluntaria de salud y a la
paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo. Les damos charlas a las madres, como cuando identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde están, dónde va el niño creciendo, los cuidados del niño que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria.
9 meses del embarazo, desde allí estoy yo pendiente. Estoy con el celular, me llaman. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora, 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso de apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos amizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto pues, fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándole capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer
Muy buenas tardes para.
Good afternoon, everyone. I hope you have enjoyed your lunch break. So let's resume. I give the floor to Maria Lu Valdez for some announcements.
Chair, we would like to inform all delegates that proposed Resolution 1, Policy for Strengthening Health Sector Action on Climate Change with Health Equity, is available on the resolution tracking system. This application can be accessed via your iPad that was given to each of your delegations. And if not, there's a number of staff here that would be most willing to help you all. Thank you, Madam Chair.
Muchas gracias.
Thank you. Let's begin with 4.5, Policy on Long-Term Care. I would like to call the Executive Committee's attention to CE 17416. I invite Dr. James Fitzgerald, Director of the Department of Health Systems and Services, the Pan American Sanitary Bureau, to come to the head table and present the item.
Madam President of the 174th PAHO Executive Committee, delegates to the Executive Committee, Director Dr. Barbosa, major demographic and epidemiological shifts in the Americas have resulted in a significant increase in life expectancy, with corresponding increases in years lived with disability and dependency, as well as demands for long-term care. Whereas needs in long-term care are substantively more significant in older persons, long-term care may be required at any age. The prevalence of disability with severe functional limitation and need for long-term care is increasing in part because of a rise in non-communicable diseases, including neurological and mental health conditions. As of 2020, at least 8 million older people require long-term care in Latin America and the Caribbean, and this figure is likely to triple, reaching 23 million by 2050. The lack of institutional capacity to respond to this need will impact human, economic, and social development across the Americas. Meeting long-term care needs constitutes a major challenge for health and social protection systems in the Americas. The formal provision of such care is currently insufficient, with excessive reliance on unpaid care provided by family members, mainly women, whose health and well-being as caregivers suffer as a consequence. In some countries, long-term care is provided by the health and/or social care sectors, but frequently with little or no coordination between them. Inadequate financing results in ill-equipped health services and staffing levels, a lack of training and professional development for care workers, and the absence of a continuum in health and social care for those with long-term care needs. The policy document presented today before the Executive Committee proposes priority actions for the development, strengthening, and expansion of long-term care in the region. It proposes 5 lines of action to support the delivery of integrated and sustainable long-term care across the life course, promoting better coordination between sectors and the delivery of services that meet the needs of care-dependent individuals and their caregivers. Firstly, it calls for the strengthening of governance, accountability, and stewardship through intersectoral policies to meet long-term care needs. Secondly, it urges countries to strengthen workforce capacity for long-term care, including health and social care workers and unpaid caregivers. Thirdly, it calls for the strengthening of the organisation and delivery of person-centred and integrated long-term care, responding to the different needs of care recipients and their caregivers. Fourthly, it notes the urgent need to increase and optimise sustainable and equitable financing for long-term care across health and social sectors. And finally, it urges Member States to strengthen information systems for long-term care, improving data collection and research. Madam President, the Secretariat would like to thank all Member States for their active engagement, participation and support during the consultative process for this policy document. The document was prepared through technical discussions and meetings initiated in November 2023. Thereafter, 3 virtual formal consultations with Member States were held in March 2023, with contributions, oral and written, being received from 22 countries. Thank you, Madam President.
Muchas gracias.
Thank you, Dr. Fitzgerald. I invite the Executive Committee to review the document, information in this document, provide any comments it deems pertinent, and consider approving the proposed resolution. I will now open the floor to the plenary for discussion on the document presented. Jamaica.
Thank you, Madam President. Dunstan Bryan, Jamaica. Jamaica is indeed very interested in the development and implementation of this policy as we move aggressively through demographic transition. One of the features of Jamaica's transition, though, through this process is a significant movement through migration of our younger population. This significantly negatively impacts and exacerbates the issues affecting health service delivery, especially to the elderly. Jamaica therefore requests that the policy significantly considers the impact of health worker migration, especially for countries within the Caribbean, with a special emphasis on assisting us in developing strategies to increase collaboration between sending and receiving countries, and these strategies do not compromise the health service delivery to the elderly population. This while recognizing the individual's right to free movement and employment. Jamaica also notes the issues of NCDs that disproportionately impacts the Caribbean region, with these illnesses representing the top 5 cause of death. It is therefore important to note that for the Jamaican population, as persons are living longer, the quality of life is significantly impacted because of comorbidities from NCDs. It is projected that this issue will be exacerbated as the contributing factors to NCDs persist within the working age population, with 50% of the current population suffering from obesity alone. We also welcome the consideration for healthcare financing, as significant costs in secondary and tertiary care, especially to the elderly, has resulted in substantial fiscal outturns for small island developing states like Jamaica. The Jamaican government is actively developing a policy on health financing and looks forward to the support from PAHO as we build out our systems for us to be more resilient. Jamaica notes that the total projected investment on this policy is some $2.5 million over the span of the program, with $500,000 being programmed for biennium 24-25, a clear demonstration of PAHO's commitment to this agenda item. Finally, the Jamaican government welcomes the direction of the policy in the area of adopting a life course approach to health service delivery. We wish therefore to highlight our collaboration with PAHO on the primary healthcare reform agenda, and the support that is being provided in the rollout of this policy. Primary healthcare reform and its concomitant inclusion of preventative interventions in the delivery of health service must be supported as we seek to achieve universal health coverage. The government and people of Jamaica are grateful for this effort by PAHO and the support that has already been provided in this reform. Jamaica supports the policy, and we look forward to its contribution in the achievement of the final outcomes of the actions that we take collectively. Thank you.
Thank you, Jamaica. I give the floor to Brazil. Thank you, Madam Chair.
To the adoption of this draft too. We also welcome the link that the Secretary has established to human rights. This issue is of a huge importance for ensuring gender equality. We know that long-term care is an essential aspect of health and social care systems in order to ensure that vulnerable populations, including elderly and those with chronic illnesses or disabilities, receive adequate care and support. Effective long-term care policies must promote access to care make it affordable and equitable, and regardless of socioeconomic status, since many individuals and families face significant financial burdens when it comes to long-term care, often leading to inadequate care or financial hardship. These policies should indeed be integrated into primary health care policies in general. Beyond access to services, we also needed to support and invest in the workforce, which includes fair wages, continuous training, and career development opportunity for caregivers. On this topic, I'd like to highlight a matter of great relevance raised during the technical meeting on the subject held by PAHO in November of last year. Long-term care has a gender dimension, with women providing more than 17% of care for older persons and experiencing higher care dependency ratios. Also, women provide over 80% of health care for people who need long-term care. It's urgent to change this reality. Meeting long-term care needs constitutes a major challenge for health and social protection systems in the region of the Americas. It's essential to incorporate the voices of those who rely on long-term care services and their families into policy-making processes. Engaging with stakeholders through consultations and feedback mechanisms can lead to more responsive and effective policies. Understanding the diverse needs and preferences of long-term care users can inform policies that better address their concerns and improve their overall care experience. A question that comes up when we read the text is that the resolution aims at strengthening interagency coordination. We would like to have some clarification on among what agencies you would like to strengthen coordination. So in conclusion, comprehensive long-term care policies must focus on accessibility, affordability, quality integration, and community-based support. Brazil believes that PAHO can provide technical support for the development, implementation, and monitoring of relevant policies and services, and designs tools and guidance for improving the financing, organization, delivery, and quality of long-term care services and systems in our region. Thank you.
Muchas gracias.
Thank you, Brazil. I'll give the floor to Argentina. Thank you, Madam President. Argentina takes note of the information presented in this document, and we're pleased to see that this organization is proposing this current policy on long-term care in order to develop and to strengthen and expand the ability to offer long-term care in the region of the Americas. Our country has supported this initiative about healthy aging in the Americas and has also taken part in different related activities. We agree that we still face the challenge of meeting the needs of long-term care and healthcare systems and for social protection in the region. We're also concerned that the formal provision of this type of service falls short and depends in large measure to non-remunerated support offered by family members, and that's why our country has focused on a few key aspects in line with the policy proposed here, which is to strengthen the stewardship of the health ministry in our nation, to fashion public health policies for older persons, to guarantee healthcare provision, preventing disease, comprehensive care, and self-care among adult and older persons who offer respectful health services, respectful of people's, older persons' needs, always focus on people and to make sure that communities foster, that is, in the different activities they carry out, that they work in care for older persons as well, and also to share information and to make available sensitive and sufficient data for analysis and health care for older persons, something that sometimes is missing in some of the countries of the region. For this, we think that it's important to recommend to the Directing Council to approve this resolution about this policy of long-term care. Thank you. Thank you, Argentina. I give the floor to Chile. Thank you very much, Madam President. Chile is very grateful for this proposal to address this topic of policy and long-term care. Chile, together with Uruguay, has the longest life expectancy of the region, comparable to that which exists in European countries. And this within a very different context that exists in developing countries. In my country, the reality of older persons that require long-term care, said care is deficient. In the 90s, Chile created centers for care for older persons called short and mid-term support services for older persons, which meet the needs of a small number of or percentage of the population, offering basic care, but still are far from meeting the needs of that population. Quantitatively speaking, that is the number of older persons that exist in Chile, and regarding their needs. Therefore, in my country, we find this proposal to be very worthwhile. We support it wholeheartedly, and we await the technical and political support of PAHO, that is, and also from countries that have more experience on this subject matter, so that we can sufficiently meet the needs of Chile, the Chilean population. Thank you. Thank you, Chile. I give the floor back to Dr. Fitzgerald to respond to the matters raised.
Madam President, and thank you to each of the delegates for your comments on this document. I think we're living in a context in which we're really seeing an accelerated aging within the region of the Americas, far quicker than has been observed in other regions. And associated with that is a significant increase in non-communicable diseases, resulting not only in disability and lack of functional capacity, particularly in older persons, but directly impacting then issues relating to the capacity of social and healthcare systems to be able to respond to needs. And so I wanted to try and encapsulate some of the comments that you made in three broad areas. The first area is around stewardship and governance, which is the first line of action of the strategy. And both Jamaica and Brazil, and indeed Argentina, cited the importance of really beginning to structure and examine what are the governance mechanisms that are required between the social care systems, the social protection systems, and the health systems that will be necessary to ensure and maintain functional capacity, particularly of older persons, but then also to address long-term care needs of the population as a whole. The governance mechanisms and structures within the countries are different. Some countries, the issue of long-term care is positioned more within the social protection systems, and health contributes to that, whereas in others, the health sector is taking the lead with the participation of social protection mechanisms. There's no formula here. The most important thing is that health is really well represented in the governance and stewardship mechanism, and that the role of the health sector is well defined in ensuring comprehensive access to services that are required. And this is the second issue, I think, that is important in terms of governance stewardship based in the community. And that's why I think some of the comments we heard around primary health care, the role of primary health care and the linkages with social care systems at the community level are extremely important. So yes, the whole issue of policy development and looking at the structures that exist within your countries for coherent intersectoral policy development that has a clear role for the health sector is extremely important. A number of you also mentioned the issue of workforce. The region is, and the director has mentioned this, the region is facing somewhat of a crisis in terms of health workforce, in terms of absolute numbers, but also in terms of distribution, availability, and quality within the health systems. We often cite within PAHO that in order for us to achieve 80% of the service coverage index that are required within SDG 3.8.1, we estimate that we'll need approximately 1.2 million health workers by 2030. And that is a number that's probably not going to occur, but it really shows you the magnitude of the problem that the region is facing in terms of the expansion of health systems and the rate limiting factor that exists, which is the availability of a quality, well-prepared, well-trained health workforce. In this particular area, I think it's important to note the comments from Jamaica. This is a worldwide phenomena in terms of long-term care, and there is an enormous pool of health workforce from the region of the Americas, either into North America or into Europe, particularly for issues around long-term care. Many of the health workforce that we do actually have are being recruited and are migrating to other countries. They may not have the sufficient qualifications to be able to execute their qualified functions in those countries, but they're being recruited for other for their other capacities. This is an area I think that's very important. We've addressed this also in the Policy on Health Workforce 2030 last year. We will be organising a discussion on health workforce migration later during the year with all the countries, but we will certainly take into consideration and include a reference in the policy document on this issue. Notwithstanding, we do need to plan and forecast, and within that planning and forecast and health workforce policy, to be able to mitigate against the potential issues around recruitment and retention of health workforce in the region. And so it's extremely important that as we implement this policy, we do take into consideration that we estimate that approximately we'll need an additional 14 million health workers by 2050 alone for the region in long-term care. A very complex issue associated with this is the role of unpaid caregiving. As mentioned by Brazil, 70% of long-term care needs are satisfied by unpaid caregivers, predominantly women. However, we are also seeing demographic changes within family structures, smaller families, migration also directly impacting the availability of unpaid caregivers in the Americas, and as such, formal structures will need to be put in place to ensure that long-term care will be provided in the absence of those that may be able to do so within the family structure. In addition, some studies that we've carried out in Brazil indicates that unpaid caregiving can actually impact economically in terms of reduction of household income. We've seen a reduction in some households in the order of 26% on account of women having to leave the workforce and assume responsibilities to provide unpaid caregiving. So the policies around health workforce are extremely important in this issue, to formalise, to build capacity, to train and to plan appropriately. Jamaica also mentioned the issue of the economic impact and health financing. This is one of the areas I think that we really need to do a lot more work in to really estimate what the concrete impact of the region and concrete requirements will be. A lot of work has been done in Europe. It's estimated that long-term care requires essentially an investment in the order of about 2% of GDP if there are not going to be significant unmet needs. We estimate in lower income countries that could be somewhere in the region between 0.27 and 0.8% of GDP for a more basic package of services. However, we really need to be able to work with the health financing sector to develop those provisions and estimations that will be required given the accelerated ageing that is occurring within the region, so that countries are very well prepared. And so I think the issue of health financing is going to be critical, not just within the health sector, but also within the social protection systems. Financial hardship is a core issue to this issue, because if individuals or families have to pay out of pocket, it may potentially result in catastrophic payments and ultimately impoverishment. We are seeing in the financial protection indices within the region, there is a level of stagnation. We have been improving over the last 10 years, but there is a level of stagnation that we are now observing. And we have to look in more detail to see if aging is contributing to this issue of lack of financial protection. So thank you very much, Madam President, for those comments. We'll take them in the next iteration of the document.
Muchas gracias, doctor.
Thank you very much, Dr. Fitzgerald. Director, do you have any comments?
Thank you, Madam President. First, I want to acknowledge the very important comments made by Jamaica, Argentina, Chile, and Brazil. I think that they shared with us their national situations and also what are the policies that they are implementing. Indeed, as was, I think that explained and presented by our Department Director, James Fitzgerald, our region, Latin America and the Caribbean in particular, is experiencing a very rapid demographic transition with impacts in several areas, including the health systems. Clearly, our health systems are not yet prepared to promote the change that we need to do in the health system, but also to participate in multi-sectoral agendas in order to face the rapid change that is being experienced by our member states. So this policy will allow us to develop this line of technical cooperation that in every country is now a priority, and in the near future we will increase. So to strengthen the capacity of the national health authorities to perform these changes and to prepare the healthcare workforce to deal with the other sectors, to have this multi-sectoral agenda, I think that is a crucial area that you need to work together with our member states. So I thank you very much, because this will strengthen our capacity to provide technical cooperation to our member states. Thank you, Madam President.
Muchas gracias.
Thank you very much, Dr. Barbosa. And now I ask the rapporteur to present the proposed resolution. Thank you, Madam President. Proposed resolution. Policy on long-term care. The 174th session of the Executive Committee, PP, having reviewed the proposed policy on long-term care, document CE 174/16, resolves, OP, to recommend that the 61st Directing Council adopt a resolution in the following terms. Policy on long-term care. The 61st Directing Council, PP1, having reviewed the policy on long-term care, PP2, considering that addressing needs in long-term care presents challenges for economies and for health and social protection systems in the region of the Americas, given current and future demographic and epidemiological trends, PP3, noting that in order to achieve universal access to health and universal health coverage, comprehensive, continuous, person-centered, and integrated LTC capacity is required to address needs, increase healthy life expectancy, improve equity, and reduce catastrophic expenditures for individuals, families, and systems. PP4, recognizing that the formal provision of LTC in the Americas is currently insufficient, with a strong reliance on the unpaid care provided by family members, especially women, and that future demand for LTC will increase significantly and rapidly, with an expected increase in levels of care dependency. PP5, recognizing the urgent need to advance the development of intersectoral LTC capacity and strengthen the capacity of ministries of health to optimize functional ability and prevent functional loss, integrating action across health and social care sectors to address the needs of both care recipients and caregivers. PP6, noting the need to improve data collection and information systems that can detect and monitor needs and prioritize actions effectively, particularly for populations in conditions of vulnerability. PP7, considering the need to invest in formal LTC provision and the cost of inaction in terms of health outcomes, healthy life expectancy, impact on caregivers, and increased risk of household catastrophic expenditure, resolves. OP1, to approve the policy on long-term care. OP2, to urge all member states, considering their national context, needs, vulnerabilities, and priorities, to A, develop and implement and monitor intersectoral policies that prioritize, create, and expand LTC capacity in line with current and projected population health needs, and formalize the provision of this type of care within health and social care sectors to increase access to LTC, especially for people in conditions of vulnerability. B, strengthen governance and stewardship capacities across all relevant sectors to meet LTC needs with effective participation of ministries of health in the planning, regulation, intersectoral coordination, and provision of LTC. C, strengthen the organization and delivery of culturally appropriate, person-centered, and integrated LTC, responding to the different needs of care-dependent individuals and their caregivers, and prioritizing the delivery of community and home-based long-term care based on the primary health care strategy. D, strengthen workforce capacity for LTC and the formalization and organization of health and social care collaborative teams, and increase training and support for unpaid caregivers who are integral to the delivery of LTC. E, increase and optimize sustainable LTC financing across all sectors as a strategic investment in health, equity, and financial and social protection of the population. F, increase data collection and research on LTC and include more LTC relevant information in national monitoring systems. OP3, to request the director to A, provide technical cooperation to member states to strengthen capacities that contribute to the implementation of the policy and the achievement of its objectives. B, support the strengthening of interagency coordination and collaboration mechanisms to achieve synergies and efficiency in technical cooperation, including within the United Nations system, the Inter-American system, and other stakeholders working in LTC. C, support the development of national intersectoral policies, regulatory frameworks, and national capacities that will increase access to LTC in the region. D, report periodically to the governing bodies of PAHO on the progress made and challenges faced in the implementation of the policy through a midterm review in 2029 and a final report in 2035. Thank you, Madam President.
Agradecemos al señor.
We thank the rapporteur, and I now yield the floor to the plenary for discussion.
De no haber entonces.
Should there be no objections, then we take this resolution as adopted. Very good. We move on to the next agenda item, which is item 4.6, Strategy for Strengthening the Essential Public Health Functions to Accelerate Health Systems Transformation, 2024-2034. I bring to the attention of the committee document CE 174/17 to the attention of the committee, and I invite Dr. Fitzgerald, Director of the Department of Health Systems and Services of the Pan American Sanitary Bureau, to come to the head table to present this agenda item.
Madam President, delegates to the Executive Committee, Director Dr. Barbosa. The 59th Directing Council of the Pan American Health Organization 2021, in adopting the strategy for building resilient health systems and post-COVID-19 pandemic recovery to sustain and protect public health gains, noted the urgency to adopt a comprehensive approach to primary health care in the Americas through a renewed focus on the essential public health functions. The essential public health functions are those capacities of health authorities at all institutional levels to act with civil society to strengthen health systems and ensure the full exercise of the right to the highest sustainable standard in health. By clarifying responsibilities, enabling multi-sectoral collaboration, and ensuring accountability, the essential public health functions support health authorities to effectively lead and coordinate policies and actions that promote health and well-being. Prior to the COVID-19 pandemic, approximately 34% of the population in 17 countries measured in the Americas reported unmet healthcare needs, this indicator increasing to 45% in 2020. The pandemic impacted health systems, exposing fragmentation and limitations in capacity of health authorities, both of which hindered effective and equitable pandemic responses. Pre-existing social and institutional structural deficiencies and inadequate attention to stewardship and governance have compounded the situation, emphasising the need to prioritise public health actions and agendas for health system strengthening. The strategy for strengthening the essential public health functions to accelerate health systems transformation 2025 to 2035, presented here today, proposes 3 strategic lines of action. Firstly, strengthening leadership, stewardship and governance for primary healthcare-based health systems through implementation of the essential public health functions. Secondly, strengthening capacity for the evaluation of the essential public health functions to serve as a basis for improved policy development and decision-making, with plans adopted around a shared public health agenda focusing on population health. And finally, strengthening public health workforce competencies to effectively implement the essential public health functions through effective workforce planning, competency development in public health, and strategies for recruitment and retention of the public health workforce. Madam President, the Secretariat would like to thank all Member States for their active engagement, participation and support received during the consultation process for this policy document. It was prepared through technical discussions and meetings with Member States, commencing in December of last year. A virtual consultation was held with Member States in March 2023, with contributions, oral and written, being received from 15 countries. Thank you, Madam President.
Le agradecemos,
We would like to thank the interpreters for the great work they do. And I apologize for straying away from the cue cards. Sometimes we go really fast. So thank you very much, because we are fully involved in the text following what the interpreters help us do. We invite the Executive Committee to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in Annex A. I will now open the floor to the plenary for discussion on the document presented.
Jamaica tiene el uso de la...
Jamaica is recognized.
Thank you, Madam President. I promise you this will be probably my last one for today. Madam President, Jamaica continues its partnership with PAHO to strengthen the essential public health functions to accelerate health system transformation in our quest to achieve universal health coverage. As such, it is a distinct pleasure to first indicate that Jamaica has identified strategic and high-priority actions focused on closing critical gaps and is continuing to align initiatives with national health plans. Jamaica, in collaboration with PAHO, has since 2019 developed and is implementing our National Strategic Vision for Health 2030, which has 6 strategic goals. Strategic Goal 1 is safeguarding access to equitable, comprehensive, and quality health care. Strategic Goal 2, the stewardship capacity of the Ministry of Health is strengthened to improve leadership and governance to achieve universal access to health and universal health coverage. Strategic Goal 3, increased and improved health financing with equity and efficiency. Strategic Goal 4, ensuring human resource for health is in sufficient numbers and competencies committed to the mission of health. Strategic Goal 5, social participation and intersectoral collaboration to address the social determinants of health, and then Strategic Goal 6, making reliable and modern infrastructure available for health service delivery. As we implement the strategic action, Jamaica has sought to introduce significant reforms in the areas of health system strengthening through the strengthening of our laboratory infrastructure, the increase in health worker availability at all levels, and increase in our health expenditure to 4.8% of GDP, a 1.2 percentage points increase since the 5-year implementation period of the strategic plan, moving us closer to the recommended target of 6% of GDP. We wish to note our existing country technical cooperation with PAHO and that we are very satisfied with the work of the country office in terms of the implementation of this collaboration. And I state here our intention to extend this collaboration for another 5 years. Jamaica notes that work is ongoing in strengthening health policy development and evaluation and improving resource allocation. We therefore thank PAHO for their continued unwavering support that is highly appreciated as we advance in our journey. We therefore wholeheartedly support this resolution. Thank you.
Muchas gracias.
Thank you very much, Jamaica. I now give the floor to Chile.
Muchas gracias, señor.
Thank you very much, Madam President. I cannot say the same thing as Jamaica because I will not commit myself to being the last Chilean statement for today. For Chile, this strategy and the statement, declaration, and commitment enshrined therein is essential. We believe that this concentrates, as you can tell by the name, the main functions to be carried out by the health sector, and therefore it seems to us that if we approve or adopt this document and this resolution, we would be providing us the possibility and the opportunity to strengthen our systems and thus respond to the needs of our population in terms of healthcare, be it through one of the 3 strategic lines of action proposed by the document. Chile, currently, as is probably the case that most of you are aware of, is developing a reform of the health sector, where the key is to strengthen primary health care. An increase in health care in terms of coverage. Nowadays, the entire Chilean population has access to primary health care for free, something that did not exist until a couple of months ago. People who had a private health insurance, 20% of the population, could not have access to primary health care. Nowadays, the entire population has access to it, and that obviously has entailed a strengthening, growth, and a development of all the people and the staff working in this sector. That also entailed negotiating with the Ministry of Finance, an issue that is clearly salient in Table 1 of the document, which is quite significant to us. And for Chile, I don't know whether this is the case for all the other countries in the region, the negotiation with the Ministry of Finance is the key point in the work we do in developing the budget and in the implementation of what is essential to us from the point of view of health policy, which is not always essential in the mind of the Ministry of Finance. Therefore, Chile strongly supports what is proposed in this document, and we're very grateful for its content. Thank you. Thank you very much, Chile. I now give the floor to El Salvador.
Gracias, señor presidente.
Thank you, Madam President. Having examined the strategy for strengthening the essential public health functions to accelerate health systems transformation, we would like to stress two sides of the same coin. On the one hand, the challenges, and on the other one, resilience. In order to create resilience, we have to strengthen the skills of health systems, and it also provides us with the opportunity to do so in a structured and improvised fashion. We've developed a health system based on the health approach at better capacities, effectively and efficiently develop the existing systems of the system, and to monitor the results established. We adopt this as a powerful tool to prioritize strategies to conduct and effectively lead the policies and measures of promoting health and well-being, creating a health system based on primary health care and with full recognition and welcoming attitude by Salvadorans. We create a capacity-building plan, creating public policies and decision-making based on evidence. I must stress in the case of El Salvador that we've been pioneers in carrying out this process with participatory workshops that involved more than 72 institutions and almost 200 stakeholders, a process that began in September 2021 in 3 phases: analysis of situation and institutional mapping, capacity measurement, identification, and projection of gaps, ending in December 2022. A final report was prepared, and later on we developed the plan of action in order to strengthen the public health functions in El Salvador. In April, we presented the first progress of this implementation plan, some actions undertaken. A program for monitoring and evaluation has been developed, improving decision-making based on evidence through the National Health Institute to order the legal and normative framework, the development of human resources based on skills, pre-graduate specialization and professionalization of the health staff, strengthening and funding of health above 6% of GDP. But what is even more important, strategies in order to have intelligent expenditure in health, improvised strengthening of health services and networks, healthy lifestyle, the use of techno guides for that purpose, with an approach more on well-being than only the absence of disease. To manage social determinants, we must go beyond other sectors in order to promote comprehensive health care. In 2022, we published a national policy for the promotion of health in order to deal with social determinants of health and the articulate work on the system. Last but not least, we should thank PAHO for the valuable support given to our country throughout the entire process. Thank you. Thank you, El Salvador. And now I give the floor to the U.S.
Thank you, Madam President. The United States thanks PAHO for developing the strategy for strengthening the essential public health functions to accelerate health systems transformation 2024 to 2023 and supports the proposed resolution. My delegation underscores the key role of this strategy in advancing health systems transformation sustainably in the region of the Americas. The COVID-19 pandemic has made clear the need to strengthen essential public health functions, to address emerging public health challenges, to enhance resilience, and to improve preparedness, response, and overall resilience in the region. This pandemic further emphasized the need to address disparities and inequitable access, and the opportunities we have as a region to strengthen health systems' capacities and performance in response to future threats. PAHO's leadership, coordination, and collaboration with member states continue to be instrumental in elevating the region's priorities and perspectives. We have a technical edit on the resolution. In PP3, line 2, we request editing it to read, "Central role in supporting the full exercise of the right to the enjoyment of the highest attainable standard of health." This language is consistent with the WHO Constitution. Again, the United States appreciates and continues to welcome PAHO's increased efforts to support member states and looks forward to receiving progress reports on this strategy. Thank you.
Muchas gracias.
Thank you very much to the U.S. We kindly ask you that whenever the resolution is read out, that you be kind enough to repeat the comments that you just submitted. Thank you very much. I now give the floor to Canada.
Thank you.
I'm not supposed to press again, I think. Thank you. Sorry about that. Just wondering if my colleague from Brazil was first on the list. Does it matter? Okay, thank you. José Roy, Canada. Canada thanks PAHO for the timely strategy, recognizing the evolving nature of public health practice amidst the globalized spread of emerging diseases, the growing imperative for collaborative efforts to bolster public trust, and the urgent need to confront systematic health inequities. Over the past 3 decades, there have been serious efforts to define and redefine the functions of public health within the wider health system, both in Canada and beyond. During the COVID-19 pandemic, public health systems activated these essential functions simultaneously, demonstrating the readiness and effectiveness of these systems in response to immediate challenges. However, it also exposed gaps in preparedness, coordination, equity, technical integration, and effective communication, prompting a critical reassessment of essential public health functions to address vulnerabilities and strengthen resilience in future crises. As such, Canada is supportive of this initiative to modernize and implement essential public health functions, aligning them with contemporary public health trends and global perspectives. We want to acknowledge other important aspects highlighted in this strategy, including data infrastructure and standards and public health workforce needs, which align with our own current domestic efforts to advance health system transformation. In this post-pandemic phase, we are undertaking a renewal of the Public Health Agency of Canada, which underscores a commitment to continuous improvement and our long-term vision of improving public health outcomes for all people and communities in Canada and beyond. As such, Canada would like to express its support for the strategy, including the proposed resolution, and note that we look forward to continuing to collaborate with PAHO and the region in this critical area. Thank you.
Muchas gracias, Canadá.
Thank you very much, Canada. I now call on Brazil.
Muchas gracias, Presidenta.
Thank you very much, Madam President. Brazil welcomes the support given to the approval of this resolution by the previous speakers. The approach proposed by PAHO agrees with the Brazilian understanding that the preparedness for a new pandemic or a new health emergency in broader terms ought to entail the integral strengthening of the capacities of national health systems in order to make them resilient. That includes the elimination of surveillance in primary health care, but also the workforce in health and the capacity of local and regional production and strategic supplies. The resolution does not cover all these dimensions, but no doubt it does go in the right direction. We need to think about an important side of the workforce migration and the need to avoid predatory competition for human resources. If possible, it would be important to add this as a part of the strategy. Thank you very much.
Muchas gracias, Brasil.
Thank you very much, Brazil. I now give the floor to Dr. Fitzgerald to respond to the comments made.
Thank you very much, Madam President, and thank you to all the delegates for their comments on this policy document. I think what we're hearing is really this growing and urgent need to link discussions around the transformation of health systems with the necessary need to build functional capacity, the essential public health functions capacities within countries, but really based on the primary healthcare strategy that ensures equity, quality, and access, while creating this foundation also of resilience within health systems. And it's this interaction between the multitude, I suppose, dimensions of a health system that we need to develop that really the essential public health functions actually speak to. A number of the countries that have spoken here today have applied the methodology, have actually taken the methodology and adapted the methodology to context. And I note, for example, the comments from Jamaica. Many other countries have had similar experiences in the Caribbean, similar to Jamaica, including Bahamas or St. Lucia, and some of the other islands of the Eastern Caribbean, taking and simplifying processes within the application of the essential public health functions to identify what the Honourable Delegate of Jamaica mentioned, to identify gaps, the gaps that need to be closed, strengthened, addressed in terms of policy development and implementation. And also El Salvador, the very interesting experience of El Salvador in the application of the methodology that really integrated processes and resulted in the National Plan for the Strengthening of Essential Public Health Functions as part of its efforts to improve the national health system. We have seen the adaptation of the methodology in a number of countries, and of course we're very happy to work with you in the adaptation, because no health system is the same. Health systems have different characteristics, different structures, different organization that require adaptations of methodologies in this regard. I also would like to note the comments of Chile and how Chile has really moved forward in the massive expansion of health systems based on primary health care and the universalization of primary health care, moving initially, I think, from 10 communes, but now adding an additional 19 communes. We were in Chile recently. We've seen the importance of the investments that are being made in Chile in this regard. This speaks to the issue of financing. And as was mentioned by a number of you, the need to not just increase financing towards this benchmark that is the 6%, that is a necessary condition but insufficient in many ways to be able to bolster public health within the region of the Americas, but also looking at the issues of efficiency and effectiveness of health financing and investments in the public health functions, investments in a primary healthcare strategy. There's no better investment that can be made in terms of effectiveness and efficiencies to either address the needs of the population, to ensure access and coverage, while really bolstering the capacity and resilience of a health system. The dialogue with the Ministries of Finance is always complex, and I think this is an area that we've been focusing on within and also outside this Alliance for Primary Healthcare that the Director launched in Uruguay in 2023, that brings together some of the institutional financing institutions that have I would say, greater facility, a more formal relationship with financial sectors within countries, but working then based on the mandates of the Pan American Health Organization to implement strategies based on primary health care. And this alliance then provides for a closer collaboration between health and finance, because we often know that finance ministers want to know about efficiency, effectiveness, I would say return on investment, and then the utilization, how we measure impact in terms of investments in health. And this is an area of work in which the Alliance now is working in and looking at issues of the impact of avoidable hospitalizations that are sensitive to primary health care in terms of financial impact and or the required investments. What do you need for a health system based on primary health care to ensure efficiency, effectiveness, and very positive health outcomes? So thank you very much. We will take the comments also from Brazil in the final document. Thank you very much.
Muchas gracias.
Thank you, Dr. Fitzgerald. Mr. Director, do you have any comment you would like to make? Yes, Madam President, I'm not going to apologize. And Jamaica's comments are very welcome. It's always very important for us to hear all of the member states about their experiences, to hear their suggestions by way of perfecting these documents. So that helps us in this dialogue. Now, regarding Chile, I do think it's very important for us to bolster this dialogue between the dialogue between ministers of the economy or finance and of health. An initiative was launched between the ministers of economy and that of health. The first round held in Panama. The second meeting is going to be held in the Dominican Republic. I took part in that first one, so I do think it's very important for us to continue holding this dialogue. Now, the Ministry of Finance of Chile has vast experience and expertise on matters of public health budgets. I had a meeting with him during the spring meetings of the World Bank. And I'm calling upon him to be a champion to galvanize the ministers of finance in the region and in their discussions with health ministers. It's very important. I think the best management of those resources that are available, that's where the ministries of finance can assist in the ministries of health in managing their budgets. So what we want is for this to be a more constructive dialogue, for us to ensure that the best investments possible be made in health to strengthen health systems and how we can better gauge or measure the impact that health can have on the region. That's very important. Now, this document, truth be told, is indeed very important. As some of you have rightfully said, many countries at this time in the region are undergoing changes, deep overhauls of their health systems, and in all of the countries, I think they're trying to apply the lessons learned during the pandemic to enhance their health systems and address some of the chronic problems existing in the region, such as the fragmentation of health care systems, the stewardship matter, now, the strategy for strengthening the essential public health functions. I think the first iteration goes back 25 years. With this new iteration, I think with this new resolution is going to make it possible for us to work better with countries to make better use of that tool with which to come up with a concrete roadmap to close the gaps and strengthen the leadership capacities and of stewardship in the ministries of health. We also take note of what Brazil said about assessing some of the important aspects to enhance the governance in health sectors, and perhaps this document will go a long way toward that. Thank you very much. Thank you, Mr. Director. I would ask the rapporteur to read the proposed resolution. Thank you, Madam President. Proposed resolution, strategy for strengthening the essential public health functions to accelerate health systems transformation 2024-2034. The 174th session of the Executive Committee, preambular paragraph, having reviewed the strategy for strengthening the essential public health functions to accelerate health systems transformation 2024-2034, document CE 174/17, resolves. Operative paragraph, to recommend to the 61st Directing Council that the 61st Directing Council adopt a resolution in the following terms: strategy for strengthening the essential public health functions to accelerate health systems transformation 2024-2034. The 61st Directing Council, preambular paragraph 1, having examined the strategy for strengthening the essential public health functions to accelerate health systems transformation 2024-2034, preambular paragraph 2, mindful of the urgency to advance in the development of more resilient, equitable, and inclusive health systems based on primary health care, PP3, recognizing the case for a renewed focus on the essential public health functions, given their central role in ensuring full exercise of the right to the highest attainable standard of health, addressing social determinants of health, ensuring universal access to integrated individual and collective health interventions, and fostering collaboration in the implementation of public health access. PP4, acknowledging that achieving universal access to health and universal health coverage requires bolstering the leadership, stewardship, and governance capacities of health authorities. PP5, considering that action by member states is essential to strengthen leadership, stewardship, and governance through a renewed emphasis on EPHF. Resolves. Up to paragraph 1, to approve the strategy for strengthening central public health functions to accelerate health systems transformation 2024-2034. Up to paragraph 2, to urge all member states, considering their contexts, needs, vulnerabilities, and priorities, to A, promote the implementation of the strategic lines of action contained in the strategy. B, strengthen leadership, stewardship, and governance for PHC-based health systems through the implementation of EPHF at all decision-making levels. C, strengthen capacity in the evaluation of the EPHF for improved policy and decision-making. D, promote the institutionalization of standardized EPHF assessments followed by systematic actions to incorporate findings into policy and investment priorities. E, strengthen public health workforce competencies for the EPHF through policies, training, and collaboration. Operative paragraph 3, to request the director to A, provide technical cooperation to member states to support the implementation of the strategic lines of action contained in the strategy. B, support regional cooperation and dialogue in health, facilitating the sharing of knowledge and experiences to enhance the capacities of member states to evaluate and implement EPHF effectively, as well as collaborative and intersectoral efforts to share best practices in health systems strengthening based on PHC. C, report periodically to the governing bodies of PAHO on the progress made and challenges faced in the implementation of the strategy through a progress report in 2029 and a final report in 2035. Thank you, Madam President. Thank you, Mr. Rapporteur. I open the floor to initiate the debate.
Estados Unidos, no sé si...
U.S., I don't know if you would like to repeat the matters raised in your prior intervention.
Estados Unidos tiene la palabra.
The U.S. has the floor.
Thank you very much. I think we agree with the proposed edit to PP3. I just want to confirm, am I supposed to reread it at this time or just okay. So our edit, one moment, to PP3 was that we would, in line 2, we requested editing to read the central role in supporting the full exercise of the right to the enjoyment of the highest attainable standard of health, which would make this language consistent with the WHO Constitution. Thank you very much.
So the office of the directing bodies will incorporate these amendments, and then this will be put to the consideration of the Executive Committee within a few moments, and we'll give them a little bit of time for them to do so. Thank you.
De acuerdo a los comentarios de Estados
Now, according to the comments made by the United States, the paragraph has made that change using supporting the for ensuring and the enjoyment of. And so it reads as follows. Preamble to paragraph 3, recognizing the case for a renewed focus on the essential public health functions, EPHF, given their central role in supporting the full exercise of the right to the enjoyment of the highest attainable standard and collective of health, addressing social determinants of health, ensuring universal access to integrated individual and collective health interventions, and fostering collaboration in the implementation of public health actions. Thank you, Madam President. Thank you, Mr. Rapporteur. I would ask if the United States is in agreement with the modifications, or rather if the floor is in agreement with the modifications proposed by the United States.
Damos entonces.
Then this resolution is hereby approved.
Bueno, ahora nos vamos a un.
Now we're going to have our half-hour coffee break, after which we will return for the last couple of documents. Let's return in 30 minutes, please.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Imagine a future in the Americas where everyone can access essential health technologies. PAHO's regional revolving funds support Latin American and Caribbean countries' commitment to making it a reality. The revolving funds are cooperation mechanisms that allow PAHO member states to pool their needs for vaccines and other public health supplies and procure them in volume and under better conditions. A fraction of each purchase goes to a capitalization account that provides short-term credit to speed up procurement processes. Other benefits are affordable and timely access to vaccines and medicines, countries can get life-saving supplies at fair prices through transparent processes. Improved health outcomes, more people receive preventative care and treatment. Reduced disease burden plays a critical role in controlling and eliminating infectious diseases and non-communicable diseases. Increased regional solidarity coordinates countries' efforts so the benefits reach the entire region. Over decades, the funds have helped the region to achieve reduction of vaccine-preventable diseases like measles, polio, and rubella, improved maternal and child health by providing essential supplies and training, strengthens health systems throughout the Americas with the availability of essential medicines. The PAHO Regional Revolving Funds are a powerful example of regional cooperation when countries pool resources and expertise. We are stronger when we work together to achieve health for all. Learn more about PAHO's Regional Revolving Funds by visiting our website or contacting us.
Over the past year, PAHO has made significant strides in fostering an evaluation culture and practice to increase effectiveness, efficiency, transparency, and accountability of its work. See some of the main goals PAHO has reached so far. 5 major evaluations conducted and ongoing. 3 of them are published, including the evaluation of PAHO's response to COVID-19, the first evaluation of the kind among all WHO regions, creation of a repository gathering all evaluation evidence in PAHO for enhanced institutional memory and learning, personnel capacity building in evaluation practices, launch of PAHO's evaluation external website for increased transparency and accountability, more than 30 recommendations from evaluations being implemented and tracked through the new evaluation platform. How has your work been informed by evaluation? Join us on this journey of continuous improvement as PAHO works to evolve and achieve better results through evaluation and learning.
Buenas. Hola Elsa, ¿qué tal está? Dentro ahí está mami, adentro. Pero primero estamos a tomar la presión.
¿Qué tal está? Pues todo bien. En las comunidades a veces no hay luz, no hay carro, no hay cómo mover una persona para la clínica sectorial, la Trinidad, y entonces uno tiene que estar ahí al lado de la paciente. Las pacientes ya se ponen bien contentas, yo voy siempre a visitarlas, ya uno ya les dice lo que tienen que hacer, que si sienten algún movimiento de algo otras cosas, que lo llamen a uno o que vayan al centro de salud, al médico.
Hace 19 años que yo soy voluntaria y a mí mi motivación de ser voluntaria fue cuando yo tuve mi tercer hijo, que mi niño fue muy enfermo y yo decía, yo no tengo quien nos apoye. A mí me quedaba largo, pues dije yo un día, yo voy a ser voluntaria, yo voy a apoyar a muchas madres que no tienen quien las apoye.
Aquí en Trinidad ofrecemos el servicio de telemedicina relacionada a mujeres embarazadas. Consiste primero en la captación de embarazadas que residen en estos lugares.
Se les solicita a la voluntaria de salud y a la
paciente que tenga acceso a un teléfono y que tenga acceso de la red para recibir esta llamada.
Ellas tienen una comunicación directa, tenemos un grupo de chat, nos informa si hay algún signo de alarma o algún inconveniente con alguna embarazada.
Tiene como objetivo principal la detección de enfermedades del embarazo mediante la detección temprana de los signos de alarma con el apoyo de las voluntarias de salud.
Todos los meses nosotros lo estamos haciendo. Les damos charlas a las madres, como identificar las enfermedades.
El proyecto también les ha facilitado a ellas varias herramientas para hacer más completa esta teleconsulta.
Tenemos muchos materiales que los han dado, como son los libros, ¿verdad? De dónde va el niño creciendo, los cuidados del niño, que tiene que tener la mamá y ella y uno también.
Me siento orgullosa como voluntaria y digo yo, hasta que ya Dios me diga, venga para acá, yo creo que voy a dejar de ser voluntaria. 9 meses del embarazo, desde allí estoy yo pendiente. Estoy con el celular, me llaman. Doña Pablita, vi que tengo dolor. ¿A qué hora le comenzó el dolor? A tal hora, 4 de la mañana, 5 de la mañana, 2 de la mañana, 3 de la mañana, a la hora que sea. Espéreme que ya voy a llegar.
Para mí, donar sangre es algo que no tiene precio, porque lo que está haciendo es donar vida a otra persona que lo necesita.
Cuando yo dono sangre me siento súper bien, me siento feliz, porque sé que hay otra persona que necesita y le estoy ayudando poquitito, no es mucho, pero para mí ya es un gran logro.
Llevo donando sangre ya hace muchos años, soy donadora activa de sangre. Realmente para mí es una causa muy importante que me mueve.
Es la primera vez que dono sangre, es una experiencia increíble. Incito a todas las personas que puedan donar, que donar salva muchas vidas.
Es la primera vez que estoy donando sangre y la verdad que ni se siente nada, súper bien.
Me parece además algo que todos deberíamos poder hacer de forma frecuente. Yo lo hago cada vez que puedo, desde que soy pequeña. Vengo de una familia donde la donación de sangre se nos inculcó desde jovencitos. Padres también son donantes y somos en general todos muy conscientes de lo necesario que es hacer esto. Es importante sacar los mitos relacionados a la donación de sangre. Es algo que se hace cada vez más rápido, de forma cada vez más cómoda. Así que nada, le diría a la gente que no le dé muchas vueltas y que si está en condiciones de donar, que se acerque, que es algo muy importante para las personas que están necesitando la sangre, pero también para que funcione nuestro sistema de salud.
Y hay que donar porque hay mucha gente que necesita.
Estoy también dando un ejemplo a mi hijo y a mi familia, y es lo que yo quiero hacer.
Acompáñenos a ver de cerca los resultados del proyecto Aumento del Acceso Equitativo a las Vacunas, el diagnóstico y la atención clínica para las poblaciones en situación de vulnerabilidad en las Américas. Cada acción en el terreno cuenta, cada actividad, cada esfuerzo, cada vida impactada. Nuestro compromiso y apoyo a las comunidades e instituciones que han formado parte del proyecto se ha orientado a trabajar en acciones para la prevención del contagio de enfermedades transmisibles, promoción de la salud mental y estilos de vida saludables. Lo anterior, alineado a las prioridades de la estrategia de cooperación de la OPS con el país.
En el área de salud de Talamanca hemos implementado ferias de salud, hemos implementado vacunatorios extramuros, tuvimos tamizajes durante todo este tiempo a nivel domiciliar, trabajando con los ATAP para tratar de encontrar esa población la cual está en riesgo social y no acuden a los servicios de salud.
Con este proyecto se realizaron actividades muy significativas como ferias de la salud, un total de 9 ferias, campañas de vacunación, talleres de salud comunitaria, de habilidades para la vida.
El principal impacto del proyecto fue promover el bienestar y la salud de la población mediante las actividades realizadas y los recursos donados.
El proyecto ha beneficiado a la comunidad tanto como en la salud y en la reducción de violencia, tanto dándole capacitación y charlas a los padres de familia y a los niños.
Con la ayuda del proyecto logramos mitigar mucho las enfermedades no transmisibles como son la diabetes y presión alta.
Los principales aprendizajes con este proyecto fue el fortalecimiento de ese trabajo en equipo de todos los que laboramos, ¿verdad?, durante este periodo de pandemia y durante este proyecto.
Creo que uno de los principales aprendizajes que dejó este proyecto es que es posible realizar comunicación adaptada a las particularidades de las comunidades.
La parte de una comunidad en pobreza, flujos migratorios de extracontinentales, el temor de la población de reunirse en grupos para poder hacer estos talleres.
Uno de los principales desafíos para la sostenibilidad de este proyecto tiene que ver con asegurar presupuesto de parte de las instituciones que formamos parte del sector social y salud en el cantón. Presupuesto que nos permita adaptar y continuar algunas de las líneas de trabajo que se lograron trabajar con este proyecto.
La OPS y sus proyectos han sido una gran bendición para nuestra área de salud, que muy agradecidos por todo esto.
Estamos en Puerto Inírida, Guainía, la triple frontera con Venezuela y Brasil, para el lanzamiento de la Semana de la Vacunación de las Américas. Buscamos reforzar la importancia de las vacunas. Las vacunas son seguras, eficientes y nos ayudan a prevenir enfermedades, así como también a salvar vidas.
Dándoles pues la bienvenida, dándole la bendición, que eso es lo que siempre hemos soñado en nuestro departamento, que llegue la salud a territorio.
La Organización Panamericana de la Salud, que está conformada por todos los países de la región de las Américas, hace un esfuerzo único para poder incrementar las coberturas de vacunación. Desde su secretariado, la Oficina Sanitaria Panamericana, trabajamos mano a mano con cada uno de los territorios, en este caso en Colombia, para poder llegar a los municipios más alejados, llegar a esas comunidades indígenas, a las poblaciones afrodescendentes, a las diferentes etnias, llevando las vacunas y también otros servicios para proteger la salud y el bienestar de los pobladores.
Y gran parte de nuestra población se encuentra ubicada en zona rural y rural dispersa. Entonces, el acceso ya se ha convertido en una de las cosas más importantes para el programa, y es, así como los niños de las ciudades reciben la vacuna, poder llegar a esos niños tan alejados y que están en una situación, hay veces de vulnerabilidad, en donde hay mayor riesgo de enfermar, ya sea porque no se tienen una muy mala nutrición. Entonces las vacunas ayudan a ese sistema inmunológico para que se desarrolle y no se enferme, porque la probabilidad de que pueda morir, por ejemplo, por un sarampión y además de una persona desnutrida aumenta la probabilidad. Entonces, vacunar a esa población susceptible y que está alejada y muy vulnerable, es de vital importancia para nosotros en esta jornada de Semana de Vacunación en las Américas. Hacemos un mayor énfasis en estos territorios vulnerables para que podamos de alguna manera utilizar estrategias para poder llegar a esta población que está más alejada y, como mencionaba, que vive en zona fronteriza y que vive en zona rural dispersa. Entonces, muchas veces lo que hacen las entidades territoriales y las secretarías de salud y las IPS que realizan estas actividades es realizar recorridos por las comunidades que viven cercanas a los ríos y que además están en frontera. Entonces nosotros debemos hacerles saber a la población que ellos son beneficiados por esto, que deben pedir y deben luchar por ese derecho que tienen hacia vacunar. Es un derecho que tienen los niños y deben exigirlo, deben exigir la vacunación.
Y por eso hay que comenzar desde la base. Estos equipos tienen que ir a atender las necesidades de cada una de las comunidades.
Algunas comunidades, algunas etnias pues no entienden pues lo que son las vacunas, pero ahí vamos paso a paso y pues que dejen de vacunar a los niños para que en el futuro pues no les den las enfermedades por las cuales pues estamos vacunando.
La jornada para nosotros ha sido productiva. Hemos encontrado algunos niños para vacunación, hemos realizado la respectiva vacunación y además sí se presta para seguir administrando las próximas dosis.
Reafirmar que las vacunas son seguras, las vacunas son eficaces, nos permiten prevenir enfermedades y salvar vidas, y las vacunas son gratuitas. Colombia ha hecho una gran inversión en el programa ampliado de inmunizaciones, tiene 21 vacunas para 26 enfermedades y son gratuitas para todos los proveedores en el territorio. En Colombia no hay barreras para la vacunación. Lleven la voz, hagan que cada miembro de su comunidad esté vacunado, protegido contra las enfermedades. Muchas gracias.
Para nosotros, la captura de pequeños mamíferos es importante para identificar diferentes patógenos. En algunas ocasiones colocamos redes para capturar murciélagos, extraemos muestras de sangre, muestras de tejido para llevarlas al laboratorio y luego entonces identificar estos pequeños mamíferos y sus patógenos que nos pueden causar algún problema de salud. El mayor problema en los murciélagos sería la rabia, que es una enfermedad que no es muy estudiada en diferentes lugares. Si hay un caso de alguna persona infectada por Hanca, tenemos que buscar entonces los sitios adecuados para poder colocar las trampas. Y principalmente la vivienda de la persona, los sitios donde habitualmente circula la persona, si es un área de cultivo, si es el patio de la casa, para aumentar el interés de que poder capturar los animales que queremos.
La OPS está desarrollando una iniciativa en conjunto con el CDC, con el Instituto Nacional de Enfermedades Virales Hemorrágicas y el Instituto Gorgas, para diseñar un taller que permita hacer la transferencia en el manejo de potenciales enfermedades zoonóticas que algunas conocemos, otras son desconocidas, como por ejemplo hantavirus y adenavirus, que ha afectado en diferentes regiones de las Américas, como Bolivia, como Argentina, Venezuela, en relación a arenavirus o hantavirus en Brasil, Argentina, Chile, Uruguay, Paraguay, Panamá, Bolivia. Pero hay otros países que desconocemos esa situación. La pandemia nos ha enseñado que no podemos quedarnos con los brazos cruzados, que debemos estar preparados, y la Organización Mundial de la Salud, la Organización Panamericana de la Salud, tuvo una vital participación y protagonismo en recordarnos de que tenemos que trabajar unidos.
Somos 3 centros colaboradores más los expertos de OPS, todos al mismo tiempo trabajando con el objetivo de diseñar un taller que sea bastante realista, que vaya a tener escenarios. Es un ejercicio tipo tabletop exercise en donde realmente los escenarios se basan en lo que hemos hecho en el pasado, lo que nos ha tocado vivir, tanto en la parte de epidemiología como en laboratorio, como de ecología. Y eso es una gran fortaleza que se tiene, que seamos diferentes centros con diferentes capacidades, con diferentes retos, pero que todos nos estamos poniendo de acuerdo para diseñar algo que va a servir a países que ya tienen vigilancia y países que no tienen vigilancia. Eso por un lado. Y justamente los retos es que no todos los países son iguales. Uno de los grandes retos es que hay algunos países que ya tienen vigilancia, diagnóstico, cosas establecidas, y hay países que realmente no es que estén empezando de cero, pero digamos que no hay una vigilancia ni de hantavirus ni de arenavirus que esté establecida. Entonces tenemos que hacer algo que funcione un poco para todos. Por eso la idea de tener estos ejercicios con escenarios y con diferentes situaciones que se puedan analizar conjuntamente. El otro reto que se mantiene obviamente es darle sostenibilidad a este tipo de iniciativa, porque nosotros pues hasta la fecha hemos funcionado a través de un acuerdo cooperativo que tenemos con la OPS, y bueno, mientras teníamos la posibilidad de apoyar ese acuerdo cooperativo lo hacemos, pero en realidad ese apoyo es muy pequeño y realmente se necesita más recursos para poder realmente montar este proyecto y desarrollarlo y continuarlo y darle sostenibilidad, porque no vale la pena mandar los ensayos, los primers, las sondas y algunos reactivos a un país y luego ya no lo pueden hacer porque ya no tienen kit. Entonces ese es uno de los retos.
Muy bien, buenas tardes.
Very well. Good afternoon, everyone. We're ready to resume and we're ready to spend the rest of the afternoon together. We're going to go to item 4.7, Strategy and Plan of Action to Strengthen Tobacco Control in the Region of the Americas 2025-2030. I call to your attention document CE 174/18, and I call on Dr. Ansel Hennis, who is Director of the Department of Non-Communicable Diseases and Mental Health of the Pan American Sanitary Bureau. Please come to the head table and present this item.
The fourth session of the Executive Committee. Distinguished delegates, Dr. Jarbas Barbosa, Director of the Pan American Health Organization, honorable ladies and gentlemen, colleagues. Thank you for the opportunity to present the strategy and plan of action to strengthen tobacco control in the region of the Americas 2025 to 2030 on behalf of the Pan American Sanitary Bureau. Tobacco consumption continues to be a leading threat to global public health, generating a great social, economic, and environmental burden for countries, exacerbating household poverty and increasing inequalities. Significant progress has been made in recent years in combating the tobacco epidemic in the region. The economic, political, legal, and social feasibility of adopting evidence-based policies in alignment with the WHO Framework Convention on Tobacco Control, especially the FCTC articles considered best buys for non-communicable disease prevention and control, has been clearly demonstrated. However, it is important to note that to date, only one country in the Americas has implemented all 5 best buys, highlighting the need for other member states to scale up their efforts to comply with global commitments. The final report of the Strategy and Plan of Action to Strengthen Tobacco Control in the Region of the Americas 2018 to 2022 highlighted the challenges faced by member states in making progress in tobacco control. The tactics of interference by the tobacco industry and its allies remain the main factor hindering the achievement of tobacco control goals. This strategy and plan of action responds to requests from member states during the 60th Directing Council for a new strategy to continue tobacco prevention and control efforts in the Americas, and demonstrates the political will and commitment of member states to advance the tobacco control agenda, implement the most cost-effective control strategies, and tackle new and emerging threats. This strategy not only reinforces the objectives of the prior mandate, building on the lessons learned, but also provides guidance on the regulation of electronic cigarettes, monitoring of tobacco industry interference, as well as provision of adequate treatment of tobacco dependence, and supports the PAHO Better Care for NCD's initiative. We gratefully acknowledge the input and engagement of member states during the regional consultative process held earlier this year, which significantly contributed to the development of this strategy and plan of action to strengthen tobacco control. The 5 strategic lines of action call on PAHO member states to 1. Implement effective measures to regulate the consumption, commercialization, and advertising of conventional tobacco products and other emerging products through smoke-free environments, banning of advertising, promotion, and sponsorship, and large health warning with images. Secondly, implement measures related to pricing and taxes to reduce tobacco demand. Thirdly, provide comprehensive quality services that promote effective measures for tobacco cessation and proper treatment of tobacco dependence. Fourthly, ratify the WHO Framework Convention on Tobacco Control and the protocol to eliminate illicit trade in tobacco products. And fifthly, strengthen the capacity of member states in public health policies to address attempts by the tobacco industry to interfere with public health policies. The PAHO Secretariat remains committed to supporting member states in their efforts to end the tobacco epidemic and the resulting preventable loss of life. We invite the Executive Committee to review the strategy and plan of action and its recommendations and consider its approval. Thank you, Madam President.
Muchas gracias.
Thank you very much, Mr. Hennis. The Executive Committee is invited to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in Annex A. I will now open the floor to the plenary for discussion on the document presented. I recognize Uruguay. Thank you, Madam President. We're very grateful for presentation of this document, which proposes a roadmap through 2030, authorizing clear measures to ensure fulfillment of the FCTC and allow member states to comply with the set targets for tobacco use and premature death due to NCDs. This strategy and plan of action are part of a perspective with equity focusing on the vulnerable groups and agrees with decisions and mandates that are both regional and global. It also incorporates the lessons learned of the unattained goals in the strategy and plan of action to strengthen tobacco control in the Americas 2018-2022 by the Pan American Health Organization, covering both the emerging systems and the what are known as electronic cigarettes, the electronic nicotine and non-nicotine delivery systems. On 6 May 2024, Uruguay, with the signing of an MOU of the FCTC between the Ministry of Public Health and the Secretariat of the FCTC, renews its commitment to work together with both institutions together to strengthen international cooperation to combat tobacco use. The agreement sets new bases for knowledge in Uruguay, a tool created to exchange and share information having to do with tobacco. Based on the reorganization of the work post-pandemic, more emphasis was given to Articles 8 and 11 of the Convention, focusing on abandoning tobacco use. We decided to change the name from Center, and now it's going to be known Center of Knowledge for the FCTC of WHO on international cooperation in smoke-free and tobacco cessation environments. Uruguay has made important strides having to do with control and cessation of tobacco use, but the industry posed new challenges that requires greater work to support the achievements. There are 18 people dying a day in Uruguay as a consequence of tobacco use. E-cigarettes and other smokeless tobacco products contain nicotine, are addictive, carcinogenic, and emit bad products. There are different products that are being marketed, aiming essentially young people as they begin their tobacco use. These elements are often used as assistance to quit smoking or tobacco, but it is not only people that don't abandon cigarettes, but they add new forms of consuming tobacco, and this is a great concern in health centers in the world. The national program wants to face the renewed challenges posed by tobacco use in Uruguay and the world based on continuous and strong interinstitutional and interdisciplinary work. In conclusion, I wanted to report that Uruguay makes available to the region what was agreed in order to think through and coordinate cooperation mechanisms to combat together the consequences of tobacco use. Thank you very much. Thank you, Uruguay. I now offer the floor to Brazil. Thank you, Madam President.
strategy and plan of action to strengthen tobacco control in the region of the Americas, 2025-2030. Commends those those members that will support the draft resolution and recognizes that the document reflects the main challenges and needs of this region. At a time when Brazil is discussing the tax reform with the selective tax for products harmful to health, including tobacco products, and reinforces the ban on electronic devices for smoking, we applaud the initiative and join PAHO for this implementation. Nonetheless, we'd like to suggest complementing OP2 from OP2E from the draft, so as to say strengthen national measures and international cooperation to eliminate illicit trade in tobacco products. We believe it's not enough to urge countries to ratify the protocol. We should also urge countries, even before ratifying the protocol, to combat illicit trade. Besides, it's clear that for its success, it's necessary to ensure human and financial resources in the regular budget of PAHO. The document provided identifies the cost of implementing this strategy in the order of $2 million for the 6 years of implementation. Although some costs may eventually be covered with extra budgetary resources, it's necessary to ensure assess the contributions for the implementation of this strategy and action plan in order to guarantee its steady and predictable implementation. Brazil would appreciate a positive return to this demand. Thank you very much, Chair.
Thank you very much, Brazil. We would like those comments to be read once again when we read the resolution, and if the observer state, if they make it available upon request. Let me now offer the floor to Canada.
Thank you. Canada welcomes PAHO's continued efforts to advance tobacco control in the region and to accelerate the implementation of the WHO Framework Convention on Tobacco Control. We acknowledge that the tobacco control landscape has greatly evolved since the FCTC entered into force almost 2 decades ago. So we appreciate that this document proposes a roadmap to help guide and position member states in the region to meet the targets established for the reduction of tobacco use and premature death from NCDs. Further, Canada strongly supports that this strategy and plan of action incorporates an equity perspective with special attention to groups in situations of vulnerability. Overall, this strategy and plan of action aligns with Canada's domestic policies and current efforts on tobacco control. We remain committed to working towards the full implementation of the WHO FCTC and enhancing measures as we advance the goal of Canada's tobacco strategy to achieve less than 5% smoking rates by 2035. Recognizing the critical importance of collective action, we also look forward to continuing to work with PAHO and with the region to achieve these objectives. Merci.
Thank you very much, Canada. I now offer the floor to United States.
Thank you, Madam President. We appreciate the intersessional consultations on the strategy and plan of actions to strengthen tobacco control in the region. The United States welcomes the 5 strategic lines of action outlined in the strategy. We are pleased to see the inclusion of measures to regulate the use, commercialization, and advertising of tobacco and other emerging products, as well as price and tax-related measures to reduce consumption and to counter attempts at interference by the tobacco industry. Despite progress, cigarette smoking and secondhand smoke exposure still claims lives daily. A commitment to health equity involves understanding tobacco-related disparities and the factors that cause them. Disparities in tobacco use are multifaceted, with influences that go beyond individual and interpersonal factors, including social, structural, and commercial drivers of tobacco use, such as aggressive marketing. Cigarette smoking remains the leading cause of preventable disease, disability, and premature death in the United States, including about a quarter of all cardiovascular disease deaths and a third of all cancer deaths. The U.S. Department of Health and Human Services continues to take action to reduce tobacco use and related disparities. Thank you very much.
Thank you very much, United States. I now offer the floor to Argentina. Thank you, Madam President. Argentina notes and is grateful for the presentation of this strategy. Since the sanction of the tobacco law, Argentina has strengthened the process for monitoring and control and the increase of taxes in the sector, improving standard policy basis and looking into tobacco cessation throughout the country. Along this line, the Ministry of Health promotes renewal of health warnings on tobacco control in order to discourage consumption, especially among young people, and improve provincial legislation to totally ban publicity, promotion, and sponsorship. With regard to this topic, Argentina prohibits the sponsorship and printing and publishing and the sale of e-cigarettes since 2011 and heated tobacco products since 2023. We believe this is a priority topic in the region due to the threat these products cause through their novelty for children and adolescents. We think it is important for this organization to set guidelines to eliminate all forms of transborder publicity, in particular for these new and emerging products, such as electronic devices to provide nicotine and heated tobacco products. We understand furthermore that nations' policies must be reinformed to avoid the promotion, publicity, and sponsorship of the products, regulate sale through total sale or the sale of products with flavored, with attractive designs for children, and effective prohibition of these products to this population group. We therefore consider it is pertinent to recommend the adoption of the proposed resolution attached to the document. Thank you very much. Thank you, Argentina. I now offer the floor to Colombia. Thank you, Madam President. We're grateful for the presentation of the strategy and plan of action currently under discussion. Tobacco use is still one of the main threats to public health in the world, and not only does it generate a burden, economic and health, but also it exacerbates poverty in households. In Colombia, tobacco is not only one of the most problematic consumptions as a society, but every year more than 34,800 people die due to diseases attributed to tobacco use, which is a high cost to the health system and has serious impact on patients and families. In our country, we believe all these deaths and diseases are avoidable, but it is necessary that as a society we take into account the dependence caused by nicotine and that institutions may work more towards prevention generated by cigarettes and other tobacco products. We therefore underscore the importance for the strategy and plan of action to accelerate the FCTC in the region, promoting more healthier, sustainable, and equitable environments, promoting the protection of young people, women, and people with lower income. It is important to also point out that Colombia has strengthened intersectoral actions through an intersectoral mechanism to control tobacco, and that is how the country has faced COP10 to regulate strict use of electronic nicotine providing devices and complying with the FCTC provisions and by the technical secretariat of the treaty. We consider that cooperation among countries and sharing experience to adopt good practices and strengthen guidelines ought to be a fundamental pillar of the strategy that is being approved today, given the need to move forward rapidly in compliance of the FCTC targets. We therefore urge OPAHO to continue strengthening the processes for technical assistance to countries that contribute to strengthen policies and guidelines for the effective implementation of the Framework Convention. Thank you very much. Thank you, Colombia. I now offer the floor to Dr. Hennis to respond to the comments.
Yes, thank you, Madam President. And let me acknowledge the contributions from Uruguay, Brazil, Canada, United States of America, Argentina, and Colombia. And really, consistently, all member states agree with the fact that the need to be aligned and to follow and fully implement the Framework Convention on Tobacco Control. There's an agreement that this new strategy and plan develops a roadmap to achieving these targets. The issue of disparities and equity was also one of the themes that was mentioned, and the fact that there are particularly vulnerable groups, particularly youth, who are now being ensnared into the trap of tobacco through digital and social marketing to take up the use of e-cigarettes. And this is one of the major threats that we now face. We have about 1 million people who die in the region of Americas every year. And in fact, we were on track to meeting the Global Monitoring Framework targets of a 30% reduction by 2025. That doesn't seem possible anymore. We're only going to achieve 27% reduction. So we were almost there, but not quite there, which really tells you of the need not to lose sight, not to lose the momentum. And some of these issues that came upon us was as a result of the pandemic, with the digital and the social marketing, etc. So there's, again, one of the constant themes was the impact in terms of exacerbation, not just of poverty, but also negative impact on the health systems as well. The cost to health, the cost to society. And there's universal agreement among member states of the need to reduce tobacco demand, to strengthen access to tobacco cessation, to use warning labels. And I think one of the new things that we bring here is the use of these innovative and novel products. So I think we're all fully agreed on the need to advance this strategy and plan. I think we have a lot more to do. We're the region that has actually achieved an entire multinational continent, South America, free of tobacco smoke in public places. But even while this is being achieved, there are areas, for example, in the CARICOM region where very few countries have made this achievement. So a lot of work, there's uneven implementation, and much more to be done. But I think we are one of the leading regions, and we look forward to working with you, our member states, to achieve the goals and targets that we have ahead of us. So thank you.
Thank you very much. I would now offer the floor to Dr. Barbosa, should he wish to comment on this item.
I want to thank all member states that made very important comments to improve this resolution, this strategy and plan of action. Last year, during the World Health Assembly, I was invited to participate in the celebration of the 20th anniversary of the approval of the WHO Framework Convention on Tobacco Control. And I was invited to recognize the tremendous progress that the Americas has made during these 20 years of the WHO FCTC. But we know that despite all these achievements, we have many challenges yet. So I was very pleased last year during our executive committee when presented the final report. Brazil made a suggestion that we should have a new plan of action, a new strategy and plan of action exactly to face these new challenges. In countries that have disaggregated data, it's very clear that the prevalence of smokers among the low-income persons are much higher. In some countries, they are the double of the figure that we have in the most well-educated persons. On the other hand, we also have, and this was highlighted by the Department Director, Anselm Hennis, with these new electronic devices, and many of you also have made reference to these problems that all the countries are facing. Adolescents are being kind of invited to experience earlier tobacco using with these false perceptions that they are healthier or less, that they produce less damage than the regular tobacco products. And in many cases, they are also being offered as an option to, with no evidence to support this, that they can support the reduction of the number of smokers. So I think that is very important to to keep this very important topic on our priority agenda due to the very important burden of tobacco morbidity and mortality in our region. So I think that the approval of this strategy and plan of action will strengthen and will reaffirm our collective commitment to advance the tobacco control in the region. Thank you, Madam President.
Muchas gracias.
Thank you very much, Dr. Jarbas Barbosa. Let me ask the rapporteur now to present the proposed resolution. Thank you, Madam President. Proposed resolution, Strategy and Plan of Action to Strengthen Tobacco Control in the Region of the Americas 2025-2030. The 174th session of the Executive Committee, preambular paragraph, having reviewed the strategy and plan of action to strengthen tobacco control in the region of the Americas 2025-2030, document CE 174/18 resolves. Operative paragraph to recommend that the 61st Directing Council adopt a resolution in the following terms. Strategy and Plan of Action to Strengthen Tobacco Control in the Region of the Americas 2025-2030. The 61st Directing Council, preambular paragraph 1, having reviewed the Strategy and Plan of Action to Strengthen Tobacco Control in the Region of the Americas 2025-2030, PP2, recognizing that tobacco use continues to be one of the greatest threats to global public health, and that, in addition to generating a heavy social, economic, and environmental burden for countries, it exacerbates household poverty and increases inequalities. PP3, considering that while conventional cigarettes remain the most widely used tobacco product, the use of electronic cigarettes is increasing among children and adolescents in some countries. PP4, recognizing that there is abundant evidence and international consensus on how the tobacco epidemic and nicotine addiction should be addressed in a cost-effective manner through the implementation of the mandates of the World Health Organization Framework Convention on Tobacco Control, known as FCTC, the protocol to eliminate illicit trade in tobacco products, the protocol henceforth, the decisions taken by the Conference of the Parties to the FCTC and the meeting of the parties to the protocol, the World Health Organization Empower Package Guidance, and the best buys for prevention and control of non-communicable diseases. PP5, recognizing that there are various circumstances that have made it difficult to implement at the national level the national and international mandates and commitments undertaken by member states to address the issue, but stressing that the common and most important challenge faced by all countries is interference by the tobacco industry and those working to further its interests. PPC 6, recognizing that the objective of this strategy and plan of action is to accelerate the implementation of the FCTC in the region by all member states, whether or not they are states parties to the convention. PP7, noting that the Global Action Plan for the Prevention and Control of Non-Communicable Diseases 2013-2020 and the Global Strategy to Accelerate Tobacco Control, Advancing Sustainable Development through the implementation of the WHO FCTC 2019-2025 have been extended to 2030 owing to the challenges presented by the COVID-19 pandemic and to ensure coherence and harmonization with the 2030 Agenda for Sustainable Development. Resolves. Operative Paragraph 1. To approve the strategy and plan of action to strengthen tobacco control in the region of the Americas 2025-2030. OP2. To urge member states, considering their context, needs, vulnerabilities, and priorities, to A. Promote the implementation of the objectives and indicators contained in the strategy and plan of action to strengthen tobacco control in the region of the Americas 2025-2030. B. Prioritize the adoption of comprehensive legal measures relating to smoke-free and emissions-free environments, health warnings and plain packaging, and total bans on the advertising, promotion and sponsorship of tobacco products in accordance with their constitutions or constitutional principles, and adapting to new digital realities covering both conventional tobacco products and other emerging products. C. Strengthen the use of tobacco tax policies as a means of reducing the affordability of products that are harmful to health, that discourage consumption, especially among lower-income groups, and that provide member states with an additional source of revenue that can be used to strengthen health and social welfare and programs. D. Strengthen primary healthcare services to increase the coverage, access, availability, and quality of tobacco cessation treatment services in the context of building stronger and more resilient health systems in the post-COVID-19 pandemic period. E. Consider ratifying the FCTC and the protocol in order to assume legally binding obligations to protect the right of every person to the enjoyment of the highest attainable standard of health. F. Counter attempts by the tobacco industry and its allied groups to interfere with, delay, hinder, or impede the implementation of tobacco and nicotine addiction control measures aimed at protecting the public health of the population. G. Strengthen their national surveillance systems in order to assess not only the prevalence of tobacco and nicotine use, but also the effectiveness of the measures implemented, and to obtain information disaggregated by sex, gender, ethnicity, and other factors, including usage data where possible, and to use this information to develop evidence-based interventions aimed at reducing disparities. H. Take into account the environmental impact of tobacco and the need to strengthen liability regulations for the tobacco industry, ensuring respect for and protection of the human rights of all people. OP3. To request the Director to A. Provide support to Member States to strengthen national capacities that will contribute to the implementation of the strategy and plan of action and the achievement of its objectives. B. Promote the exchange of information among Member States and partnerships with other international agencies and sub-regional bodies and with members of civil society and academia at the national and international levels, including the mobilization of human and financial resources in support of the implementation of this strategy and plan of action. C. Report periodically to the governing bodies of the Pan American Health Organization on the progress made and the challenges faced in the implementation of the plan of action through a midterm review in 2028 and a final report in 2031. Thank you, Madam President. Thank you very much, Rapporteur. I now offer the floor to the plenary for discussion.
Chile tiene la palabra.
Chile? Thank you very much, Madam President. Chile echoes a proposal recently made, would like to propose the inclusion of a new paragraph after OP2. After OP2E, we want to propose a new paragraph. It would be a 2F, to strengthen national measures and international cooperation to eliminate illicit trade in tobacco products. And after this general point, we see details having to do with the tobacco industry and others. Thank you, Madam President. Thank you, Chile. I now offer the floor to Ecuador.
Muchísimas gracias, Gonzalo Vega, Ecuador.
Thank you very much. Greetings from Ecuador. We appreciate the work that has been done, and regarding operative paragraphs 2 and 3, we would like to request some minor changes. Under Op 2, under D, it says give priority to prioritize adoption of comprehensive legal measures relating to smoke-free and emissions-free environments, health warnings, etc. We would say prioritize the adoption of legal measures, comprehensive legal measures, of smoke-free and emissions-free environments, health warnings, etc. Then, in the case of paragraph 3, we would also request a small change. At the top it says, provide, this is subparagraph A, provide support to member states. We would suggest that we say, provide technical and financial support to member states. Adding technical and financial. Thank you. Thank you, Ecuador. GBO will include the changes, and the draft resolution will be brought to the consideration of the Executive Committee in a few minutes. Okay. They will include the changes that have been proposed, and then tomorrow we will share the document again. Okay, with that, we can go on to item 4.8, Strategy on Integrated Emergency, Critical, and Operative Care, 2025-2030. I call to the attention of the committee document CE 174/19, and I call on Dr. James Fitzgerald, who is Director of the Department of Health Systems and Services of the Pan American Sanitary Bureau. I would ask Dr. Fitzgerald to come to the podium.
24th PAHO Executive Committee, delegates to the Executive Committee, Director Dr. Barbosa. An analysis of integrated emergency, critical, and operative care in the region reveals a context characterized by a lack of access to specialized surgical and critical care services, particularly in remote and underserved areas, and a variability in quality and standards in care, including in pre-hospital and ambulatory care. As the COVID pandemic so readily exposed, ensuring access and coverage in emergency, critical, and operative care is a central component of a national emergency preparedness and response strategy, including intensive care. In addition, it is central to the achievement of universal access to health and universal health coverage, particularly in the enhanced management of chronic diseases, maternal and neonatal health, care for older persons, and traffic accidents. A resilient and flexible, integrated emergency, critical, and operative care infrastructure supports uninterrupted service delivery and effective emergency responses, ensuring the continuity and efficiency of essential health services across the health service delivery continuum. The Strategy on Integrated Emergency, Critical, and Operative Care 2025 to 2030 highlights the pivotal role of such care within integrated health service networks, emphasizing policy-driven integration of services across care settings. It promotes seamless collaboration across hospital and pre-hospital care, including services at the first level of care, to create a comprehensive healthcare continuum. The strategy is designed to strengthen clinical management and emergency responsiveness, ensuring universal access to care with financial protection. The strategy proposes 3 priority lines of action. Firstly, enhancing operational efficiency in integrated emergency, critical, and operative care within integrated health services networks. This requires redefining governance structures and coordination frameworks within health services, ensuring coherence and coordination between hospital, pre-hospital, and the first level of care, including emergency care. Secondly, promoting integrated clinical management and quality in integrated emergency critical and operative care. This includes the adaptation of national or broadly applicable clinical guidelines for the incorporation into clinical pathways, disease management programs and protocols at the local level to improve care and ensure patient safety. And finally, a specific line of action to strengthen emergency care capacity. The objective of this strategic line of action is to promote the establishment of unified, efficient emergency care response capacity that is adaptable to various emergency scenarios. Madam President, this strategy was developed at the specific request of Member States during the 173rd session of the Executive Committee in September 2023. The Secretary would like to thank all Member States for their participation and support received during the consultation process for this strategy, which was held in March 2023, and for their contributions, oral and written, which were received from 19 countries in this regard. Thank you, Madam President.
Muchas gracias. Se invita.
Thank you. The Executive Committee is invited to review the information presented in the document, to provide any comments it deems pertinent, and consider approving the proposed resolution attached in Annex C. I now open the floor to the plenary for discussion of the document presented. Brazil has the floor. Thank you, President. I support the strategy of the Pan-American of PAHO to support the strategy on integrated emergency critical and operative care. This is important in terms of moving towards universal health coverage. This aligns with PAHO and the WHO resolution responding to the urgent need of providing critical care as part of the primary health care strategy. Surgical care, emergency, operative care is important in a robust health strategy, as we learned during COVID-19, showing the need for resilient assistance. The PAHO strategy promotes the use of these services, assuring a quick response using standardized protocols and practices that are evidence-based. To strengthen the infrastructure, along with investment in health technology and ongoing training of personnel, is important to maintain a high level of care and to efficiently manage the resources of complex organizations. It's important to promote the participation of communities and to empower patients by involving them actively in their own care and in making decisions on their own health. This not only improves the patient's experience, but also it contributes to the efficiency of the healthcare system. It lowers the burden on emergency service and intensive care. The resolution reflects the importance of cooperation among states and the role of the organization. What type of cooperation is the Secretariat thinking of behind paragraph 3B, OP3B? Now, regarding PAHO strategy, I would point to the importance of intersectoral cooperation and sustainable funding, so as to be able to provide surgical care, emergency and critical care. The political commitment are essential to establish and maintain resilient and equitable healthcare systems. In conclusion, we consider that supporting this strategy is absolutely essential to strengthen the healthcare systems in the Americas, making sure that all individuals have access to high-quality emergency, critical, and operative care. This will not only improve the results in terms of health, but it will also move us towards universal health care coverage by assuring an effective response to health emergencies. We congratulate the members supporting this strategy. Thank you. Thank you, Brazil. With that, I recognize Ecuador. I wanted to thank the President. I thank my colleagues. Ecuador welcomes this strategy as presented, and we appreciate the design behind this work, the contributions of the Secretariat, the members. Now, Ecuador expresses its decided support to this strategy, and we also support approving the corresponding proposed resolution. Thank you. Thank you, Ecuador. I call on Dr. Fitzgerald to respond to the comments that have been made on this agenda item.
Delegates of Brazil and to Ecuador for their comments. Just to really highlight that and to thank Ecuador for bringing this to the Executive Committee and for the support that was received in preparation, not just from Ecuador, but from all member states in its development. Central to that was much of the work that we had carried out during the pandemic, where we had published, many of you will recall, the Pulse surveys, where we published the impact of COVID-19 on the availability of essential health services. And what we really saw coming from that was the impact of COVID-19 on access to emergency care, surgical care, operative care. And there has been, in fact, somewhat of an impact still in terms of waiting lists and availability of capacity within health systems in the Americas to be able to address that. Many countries are making important strides in this area, and we've been working with Brazil and Chile, in particular, on this in this area as well. But just to notice that it was really highlighted the importance of the necessary capacity that is required within a broader strategy on primary health care to ensure specialized care that must be available to address the complex needs of the population across the care continuum. So thank you very much.
Muchas gracias.
Thank you, Dr. Fitzgerald. Dr. Barbosa, do you have any comments? Thank you very much, Madam President. First of all, I would like to express my appreciation for the comments that were made by Brazil and Ecuador. And also, I wanted to recognize the leadership of Ecuador in this area. 2 years ago, we had an event as part of the World Health Assembly, and that event was coordinated by Ecuador and other countries to call our attention to an issue that often is not covered. With all of the data that we have to identify the gaps that exist in countries, and often there are populations that have very limited access to operative care or intensive care, emergency care. So approving this strategy will definitely bring significant development to the region. The region is taking leadership in this regard, and this will help member states identify the gaps and see what the best strategies are to actually guarantee broad-based and universal access to operative care, as well as critical and emergency care in the region. Thank you. Thank you very much, Dr. Barbosa. Now I would ask the rapporteur to read the proposed resolution. Thank you very much, Madam President. Proposed resolution, strategy on integrated emergency, critical, and operative care, 2025-2030. The 174th session of the Executive Committee, preambular paragraph, having reviewed this strategy on integrated emergency, critical, and operative care 2025-2030, document CE 174/19, resolves, operative paragraph, to recommend that the 61st Directing Council adopt a resolution in the following terms. Strategy on integrated emergency, critical, and operative care 2025-2030. The 61st Directing Council, preambular paragraph 1, having reviewed the strategy on integrated emergency, critical, and operative care 2025-2030, preambular paragraph 2, recognizing the vital role of integrated emergency, critical, and operative care in providing comprehensive responses to a wide range of health emergencies, from acute medical conditions to complex surgical interventions. PP3, acknowledging the disparities in access to IECO care across the region of the Americas and the urgent need to expand these services in underserved areas thereby ensuring the right of all individuals to timely and effective health care. PP4, aware of the need to strengthen health system resilience in response to natural disasters, pandemics, and non-communicable diseases. PP5, understanding the importance of strategically enhancing integrated emergency, critical, and operative care through the design and organization of these services with integrated health service delivery networks through the adoption of digital health technologies for improved coordination, comprehensive training for healthcare professionals, and the implementation of quality and safety standards in all settings. PP6, emphasizing the need for integrated emergency, critical, and operative care services be provided as an integral part of the primary healthcare approach, which fosters seamless patient referrals across different levels of care, placing patients at the center of well-coordinated healthcare continuum spanning primary, specialized, emergency, critical, and operative care. Resolves. Operative paragraph OP1. To approve the strategy on integrated emergency, critical, and operative care 2025-2030. OP2. To urge all member states, considering their context, needs, vulnerabilities, and priorities, to A, implement the strategic lines of action contained in the strategy on integrated emergency, critical, and operative care 2025-2030. B, improve the design and enhance the integration of emergency, critical, and operative care across health service networks to ensure a seamless continuum from pre-hospital settings, including primary care and medical transport, to hospital care, thereby supporting universal access to integrated emergency, critical, and operative care services with financial protection for the population. C, invest in the infrastructure of healthcare facilities to support operational efficiency and safety in integrated emergency, critical, and operative care, ensuring continuous access to essential utilities and technologies, and adopt digital clinical decision support systems to optimize patient triage, waiting lists, and management of critical care resources. D, utilize evidence-based tools and integrate clinical guidelines into local protocols to standardize care across different healthcare settings, thereby improving patient outcomes and care quality, while actively engaging patients and communities in their healthcare journey. E, adopt measures to ensure the protection of health workers in integrated emergency, critical, and operative care, and prioritize the continuous education and training of healthcare professionals across all levels of care, incorporating new information and communication technologies, telemedicine, telehealth, online education, and learning networks to enhance response capacity and quality of performance. Operative paragraph 3, to request the director to A, provide technical cooperation to member states to strengthen capacities that contribute to the implementation of the strategy and the achievement of its strategic lines of action. B, promote collaboration among member states in relation to the strategy of integrated emergency, critical, and operative care. C, report periodically to the governing bodies of PAHO on the progress made and challenges faced in the implementation of the strategy through a midterm review in 2028 and a final report in 2031. Thank you very much, Madam President. Thank you, Rapporteur. I now offer the floor to the plenary for discussion. Very well. If I hear no objections, I declare the resolution adopted. We have gotten our homework done today. So what we're going to do now is look at what we're going to do tomorrow. We begin at 9, and we will be dealing with 5.2, financial report of the director and report of the external auditor for 2023. That is official document 370. Then we will go to item 5.5. Report of the Office of Internal Audit for 2023, that's document CE 174/24. And then item 3.7, report of the Audit Committee of PAHO, document CE 174/10. Then we will come back to the proposed resolutions that are still pending approval. That would be 4.3 and 4.7. Let's see. Then, after that, we would go to 4.9, which is strategy on epidemic intelligence for strengthening early warning of health emergencies 2024-2029. That's document CE 174/20. Then we will go to 5.7, update on the status of the Latin American Center for Perinatology, Women and Reproductive Health. That is document CE 174/26. And item 5.8, report on the charge assessed on the procurement of public health supplies for member states. That is document CE 174/27. Also, we will deal with 7.1. No, she corrects herself, 7.2. Which is a report on strategic matters between PAHO and WHO. That is INF-2. Then 7.3, which is application of the International Health Regulations. That is 174/INF-3. And then 7.4, if we have time, which is the Plan of Action for Entomology and Vector Control, 2018-2023, final report, CE 174/INF/4. With that, I give the floor to Marilu Valdez for some announcements.
I just wanted to remind everyone, our delegates, that this evening at 6 o'clock, our director, Dr. Jarbas Barbosa, will be hosting a reception on the 10th floor in room 1017 in honor of the participants of the Executive Committee. So we look forward to seeing you then. Thank you.
Muchas gracias. Bueno, tenemos a las 18 horas la recepción.
Thank you very much. I look forward to seeing you at the reception hosted by Dr. Jarbas Barbosa. So we can stay here in the delegates' room if we want to do that before the reception, and then we will see you at 6. So thank you very much for your patience today. Yes, Brazil has the floor.
I'd like just to remind our colleagues of the invitation we circulated last week for an event at the Brazilian Embassy to be held tomorrow, Tuesday, the 25th of June, at 6:30 p.m. On the theme of this event is the Alliance for Primary Health Care in the Americas, is strengthening the foundation of resilient health systems. There will be transportation outside PAHO's main entrance to the embassy, leaving at 5:45 p.m. and coming back to the headquarters at 8:30. So, due to space limitations, please make a reservation for your attendance. But just a kind reminder. Thank you very much.
Muchas gracias, Brasil.
Thank you, Brazil. With that, we do come to the end of our work for today. Thank you.